Good morning, Vaba. I'm just checking on my audio to see that I'm clear. Thank you.
Good morning, colleague. Yes, you're audible. You're clear. Thank you.
Morning, Chair, Ms. Peterson.
Morning, Ms. Abrams. Morning,
Good
Jazzy.
morning. Good morning.
How are you, Jazzy?
I'm well, thanks, en julle.
Meer lekker voor die wind, dankie.
Good luck for today, Ms. Peterson. Yumna Alexander confirmed for this afternoon. So I spoke to her twice and she's really keen to present. So we'll hear from her this afternoon because this morning she's busy.
Okay, sure.
Good morning, everyone. I just want to test my audio. I hope you all can hear me.
Good morning, Doc. I think you're Doc. Yes, you're audible. You're clear. Thank you so much.
Excellent. Thank you. Good morning, everyone.
Recording in progress.
I wish to welcome everyone on the platform. It is exactly 9 o'clock, and a warm welcome to everyone to day one of Leg 2 of Parliament's Statutory Rape of Girls Enquiry and Stakeholder Engagement. I am Liesel van der Merwe. I'm the chairperson of the Portfolio Committee on Women, Youth and Persons with Disabilities. I would like to extend a warm welcome to all honourable members that are on the platform. I would like to extend a warm welcome to all our stakeholders, the delegation from the Commission for Gender Equality, the delegation from the South African Human Rights Commission, delegation from UKZN, the Sexual Reproductive Justice Coalition, the Executive Director of Lifeline Rape Crisis, the Centre for Child Law from the University of Pretoria, Dr. Joan van Niekerk, also other child activists that are with us this morning, the delegation from UNICEF, from the Nelson Mandela Children's Fund, from the South African Disabled Women's Organization, and from the South African Coalition, Child Rights Coalition. You're all very welcome. I'm not going to do the formal welcoming remarks because I also have got the honor to welcome this morning the House Chairperson of the National Assembly for Committees, Oversight and Public Participation, Honourable Frolic, who will be welcoming us in a little bit. Honourable members and colleagues, Mr. Dumizweni, can I ask that you please just table our agenda so that we can adopt it and deal with apologies this morning?
Good morning, Chairperson, honourable members, colleagues, guests, or stakeholders. Yes, Chair, we've got a draft agenda in front of us. It indicates that the meeting is held today from 9 to 4. We're expecting to finish at 4. It's virtual. Then, Chair, you'll be, as the first item, you'll be doing the opening and also be facilitating the item of the adoption of the agenda. As already have done with you are done with the introduction of the guests, then the welcoming and setting up the scene will be done by Honourable House Chairperson Honourable Frolic. The overview, key findings and recommendations from GP and East stakeholder engagement that was conducted in the Eastern Cape and Gauteng will be done by Ms. Kashifa Abrahams, the content advisor of the committee. And item number 4 will be the submissions by stakeholders, which include the ones that we have welcomed, Chair. Then it's going to be discussions, closure, and vote of thanks, Chair. That's all in terms of the agenda items. Coming to apologies, Chair, we have received apology from Honourable Khwekane, who's currently in another meeting. Honourable Mbiko has also indicated that she's experiencing some network challenges. I would also love to indicate, Chair, that in this meeting we've got secretaries of other committees and members of other committees, which, if you allow me, Chair, I will request each secretary to table apology for his or her members. Thank you, Chairperson.
Yes, thank you so much, Mr. Dumizweni. Let's do that. If the other committee secretaries can also just tell us which of their members are in our meeting, and also just to table the apologies. I did see Honourable Van Staden, I did see Honourable Swart, I saw Dr. Leroux, I think. So let's hand over to them, please. And they're also very welcome to this meeting. I also saw Honourable Chirwa.
Morning, Chair. I'm also connected now. I had difficulties earlier on. It's Pego from Health. Thank you, Chair.
Good morning, Chairperson of Health. Thank you very much for joining us. Mr. Dumizweni, let's hand over to the other committee secretaries, please.
Good morning, Steve Swatcher. Just to say thank you for the invitation. Thank you for being here. I will need to leave at some stage as well, so just apologies for that for other commitments. Thank you, Chair.
Thank you very much, Honourable Swart, and thank you very much for joining us.
Sorry, Chair. I think other secretaries are still going to join, but from the PC on health, Chair, we received apology from Honourable Clark. He or she's writing exams, Chair. So I think I will indicate as soon as other secretaries join. But to those from who are busy with the ad hoc committee, that is police and justice, have indicated that it's unlikely that they will join us today, Chair, due to their program. So I was expecting health, social development, and basic education. But like I've indicated, I will indicate when they have joined, Chair. Thank you.
Thank you very much, Mr. Dumizweni. Members, may I then please ask that you that I take hands for us to adopt our agenda for this morning, please. Honourable Tsotetsi, followed by Honourable Shabango.
Thank you and good morning, Chair, and everyone on the platform. I do move for the adoption of the agenda. Thank you very much.
Thank you, Honourable Member. Honourable Shabango.
Good morning, Chair, and all members on the platform. I second the adoption of the agenda. Thank you.
Thank you very much. Okay, that is our agenda dealt with. We warmly welcome then the Chairperson of Health as well with her delegation and all the other members of Parliament that are not members of our portfolio committee. You're all very welcome in this session this morning. I would like to see if House Chairperson Frolick is with us and whether he's ready to do the opening remarks. Okay, I don't see Honourable Frolick yet. May I then ask that we go to Ms. Abrams just to give us an overview of the work that we've done so far. We have already concluded as a portfolio committee leg 1 of our engagements, which took us to Gauteng and East London, to the province of the Eastern Cape. So I'm going to hand over to you, Ms. Abrams, just to give us a summary of the work done so far, and then while we wait for Honourable Frolick to join us. Over to you, Ms. Abrams.
Good morning, Chairpersons, the honourable members, colleagues and guests. I'll just share my screen. Sorry, just one moment. Thank you. As Chairperson van der Merwe has indicated, I'll be taking the participants and delegation and members through the key findings and recommendations from the stakeholder engagement the committee had conducted in Johannesburg and East London. The intention of the engagement was really to establish the magnitude of the problem, what the issue is. As per the ATC referral, it's to understand why are nurses and teachers not reporting, what the challenges are, what stops people from reporting, and besides looking at what the issues are, but also to establish where possible and where relevant and practically what is working and why. And through discussions, ascertain what the recommendations are and what can be done to address the issues. With respect to the stakeholders, the committee commenced its engagement in Johannesburg on Friday the 31st, and that was followed by Saturday the 1st of November. On the first day in Johannesburg, the committee engaged with all the relevant provincial departments, Department of Education, Social Development, Health, SAPS, NPA, We were also attended by and joined by Ukuruleli councillors, as well as the Committee on Gender, Youth and People with Disabilities from the City of Johannesburg, the Speaker of the City of Johannesburg Council, as well as MECs. On the second day in Johannesburg, that focused particularly on the NGOs, with a select few engagements from inputs from the Teddy Bear Foundation, Johannesburg Child Welfare, Childline, Joburg Parent-Child Counselling Centre, Soul City, as well as inputs from Councillor Caldine Smith. In East London, the committee followed a similar process. We commenced on the 3rd of November and concluded on the 4th. We started off with engagements with the Department of Eastern Cape Department of Health, Education, Social Development, SAPS, NPA. We were also joined by MECs and a commissioner from the Commission for Gender Equality. In terms of stakeholder engagement, the committee received inputs from Masimanyani, Childline, Child Welfare, CMR, and we also visited Tutuzela Care Centre at the Celia Makiwani Hospital. The afternoon of Monday, the 3rd of November, through the work of the Commission for Gender Equality, the committee was able to engage with traditional leaders. The committee concluded its stakeholder engagement on the 4th of November with inputs from SAPS and the NPA, as well as a visit to the Cambridge Police Station. The key findings and recommendations have been captured in what we call daily reports. We have 4 daily reports, and they are substantive. They've been circulated to members of the committee, and essentially they cover thematic areas, what the general key findings and recommendations were, matters pertaining to policy and law reform, statistics, data management, service delivery, resources in terms of human resource, finance, vehicles, infrastructure and the like, training and capacity building, as well as any other key findings and recommendations. In terms of the general recommendations, the issue was quite clear. Statutory rape is not limited to girls. The major concern was about the boy child and children with disabilities. The importance of having to include boys in the conversation, both as victims who are often shamed into silence and as young men who need to be educated on consent. Both Johannesburg and East London NGOs spoke about the secondary trauma victims continue to endure unabated in various settings, particularly at police stations. With respect to disability, again, the issue here was the concern around children's disabilities, particularly cognitive disabilities, and the susceptibility to abuse. With respect to poverty and economic dependence, poverty renders young people, particularly girls, vulnerable to exploitation and transactional relationships for basic needs. In both provinces, various stakeholders indicated that often, because of the conditions of poverty, families often accept money from perpetrators in exchange for dropping charges. With respect to normalization of violence, it appeared that violence against women and girls have become normalized. Normalization of intergenerational relationships and transactional sex. Parents are often complicit or unaware in terms of abuse, that the silence protects perpetrators, but the voices protect the victim. The other issue that had come out in both provinces was the increase in seen in the technology-facilitated harm, and that children must be informed of the online risks of cyberbullying. In terms of cultural and societal barriers, the poverty and cultural practices are used to justify or conceal the abuse. There's fear of reprisal and social stigma, which deters persons from reporting, engagements with traditional healers, matters raised related to Ukutwala and Iteyo. With respect to the value crisis, in both provinces again, there was a strong feeling and discussion around the societal values crisis, that bad behavior is excused by financial hardship, and financial tokens are often offered to families of victims. With respect to lack of education, communities, especially in rural areas, often lack awareness and education about what constitutes rape and what their sexual rights are. With respect to teenage pregnancy as a proxy for statutory rape, again, both provinces across stakeholders, that teenage pregnancies are often the only indicator of statutory rape, that many cases go unreported due to illegal abortions, community silence or lack of awareness, and there was a major concern that there's no automatic investigations when children under 16 present with pregnancies or STIs. An example around this particular matter was stakeholders indicated if a person with a gunshot wound presents at a police station, that person would not be allowed to leave until the case is open and police are brought to the hospital to look at the issue. The same principles not applied to victims of statutory rape, which is concerning. With respect to poor interdepartmental coordination, overall lack of multidisciplinary teams and trauma-enforced care, it was really unclear how different departments worked together, and this was exacerbated by the differing in reporting mechanisms and methods. Statistics were incongruent and not unified, and there was no one place in which all of cases could be tracked and recorded. With respect to fragmented service delivery, services at TCCs are highly fragmented, significant variations in the level of service and what's available. And again, the services between departments appeared fragmented despite referral pathways that's currently in place. The lack of MOUs between the Department and Health and the NPA, this was in relation to the TCC. And with regards to registers, the Child Protection Register and the Sexual Offences Register exist, but they're fragmented and not linked. In terms of accountability, staff at the TCCs have unclear, conflicting lines of accountability, with different personnel reporting to the GST, the Department of Health, and the NPA. This makes unified management and consistent service delivery very difficult. No accountability for underage pregnancies, no consequence management for failure to report. And this was across departments and NGOs noting this particular concern. The failure of SAPs, schools and clinics. Police officers often are unhelpful. They try to mediate or discourage victims from opening cases. Schools, clinics, police often fail to act on disclosures of signs of abuse. And with regards to scholar transport, also identified as an area where learners are vulnerable to exploitation and abuse. With respect to the statistics, the numbers are concerning in terms of statutory rape, sexual abuse, GBV, child pregnancies, termination of pregnancy, and bullying. In terms of the data itself, we've across 2 provinces, the committee was privy to being reported and receiving reports on age categories 10 to 14, 15 to 19 years. But children, as we would remind members and guests, are persons under the age of 18. Both provinces, there was no indication of statistics for teenage pregnancy, STIs, or TOP for the under 10, which was also concerning. Statutory rape and exploitation of minors are underrepresented. Definitely incongruency between departments, between governments, as well as the NGOs, and a lack of an integrated reporting system between the various key stakeholders, which is DBE, Social Development, Health, in terms of the registers, as well as SAPs. With regards to awareness programs and sexual reproductive health, appear not to be implemented effectively. And despite these programs being implemented, the numbers show a different story. In terms of policy and law reform, overall poor implementation and lack of understanding as to what the law and policy entails. With the current National Strategic Plan on GBVF, stakeholders indicated it's really heavily adult-focused. The mandatory reporting of statutory rape cases is not consistently enforced. Schools often fail to report due to fear, lack of clarity on protocols, or community pressure. Police stations sometimes refuse to accept reports from educators or children, insisting the parents must report, even when the parent is the perpetrator. Overall lack of mechanisms to deal with withdrawal of cases and prosecution in this regard. In terms of resources and the key findings, funding constraints, we've heard from NGOs their heavy reliance on donor funding and the impact of cuts with regards to PEPFAR and USAID, and overall government departments indicating the limited fiscus impacts on their service delivery. Inefficient resource allocation, rural areas and vulnerable groups in terms of disabled children are underserved. And there was clearly a disjuncture between where the current resource allocation is heavily based, administration versus community-facing services. And that corruption and the misuse of resources was also a key finding which had emanated both in the Eastern Cape and Gauteng. In terms of lack of police stations, especially in deep rural areas, the idea of mobile police vans officers was suggested as a solution, and that the lack of support for traditional leaders, the traditional leaders stated that they lack government support for their initiatives, specifically highlighting a need for funding and partnership from the Department of Social Development. Moving then on to the recommendations, and again, we've captured the recommendations according to the themes as coinciding with the key findings. In terms of general recommendations, for the boy child, it's not to leave the boy child behind. There was an acknowledgement that yes, the current referral focuses on the girl child, but there needs to be a focus on the boy child. With respect to vulnerable children, particularly children with special needs, children living in impoverished communities, and that in terms of schools and ECDs, that this is a place where the majority of children spend most of their time, and hence there needs to be a particular focus around identifying children in need, as well as children that have been affected. Another key recommendation was around the vetting of drivers for scholar transport. In terms of policy and law reform, with the current review of the NSP that's due, the key suggestion was that the review must align with child-centered frameworks. In terms of standardized frameworks, that every TCC should have its service blueprint or framework clearly displayed, and this would enable transparency and a common standard for all centers to adhere to. The suggestion was also to look at triangulation framework to ensure the mandatory reporting compliance is aided and facilitated, to introduce legal protection for reporters. The protection is really around the whistleblowers. And the concern was for people who do come forward, who do their cases, what are the safety mechanisms for that reporter? Linking then to the NSP to create a child abuse national strategic plan, to incorporate recommendations into implementing department and link to norms and standards, as well as M&E processes. And then overall to standardize referral pathways and standard operating practices. Continuing around the service delivery is around the strengthening the internal coordination. One, to establish a unified framework for collaboration with all key stakeholders, supported by a centralized tracking system to monitor cases and service delivery, and to implement what is called the 24/72/7 model. So within the first 24 hours, particular things need to be ensured that happens, that protects the victim within the next 72 hours, and then within the first week, within the first 7 days. In terms of policy reform and legal alignment, to review and harmonize laws on age of consent and access to reproductive health services, and close protection gaps for minors, to ensure stronger enforcement of existing laws, mandatory reporting platforms across departments to address loopholes and strengthen child protection, ensure automatic investigations when children under 16 present with pregnancies or STIs, clarify reporting hierarchies and harmonize legislation to create a single, clear reporting pathway, to expand legal definitions, criminalize failure to report, as well as case withdrawal and compensation payments. And with respect to legal accountability, enforce penalties for professionals failing to report and ensure compliance monitoring was and integrated into departmental audits, with traditional leaders should create and enforce bylaws that make it a punishable offence for any community member or guardian or parent to fail to report an act of statutory rape. With respect to service delivery, in terms of protecting the vulnerable, to create specific programs and protections for the most vulnerable, including children with disabilities and children living in non-parental care, that is, children living with relatives, expanding the TCCs, integrating the referral pathways with all the key stakeholders, and to create a unified electronic referral system that would link these departments and to track cases in real time. In terms of education and awareness, to implement comprehensive sex education for children and youth, for programs to focus particularly on boys and to re-educate men, to scale up community engagement using media, faith leaders, youth clubs to shift harmful norms, promote digital safety and open parent-child communication, as well as implement targeted awareness campaigns, specifically emphasizing criminal liability for failing to report, the definition of consent and age of consent laws, as well as the available support mechanisms such as FCS units, Childline, and the like. With respect to data management and M&E, is to establish a centralized database to improve data sharing and strategic planning, develop a centralized GBV and child protection information system, thereby integrating SAPS records, health clinic and forensic data, the social development form, both the 22 and 23, and school incident reports to utilize data analytics to identify hotspots, monitor case progression, and evaluate intervention effectiveness. Scientific resource planning to match staffing and tools with caseloads, as well as track case outcomes and institutional accountability. To provide statistics on special needs around school rape and cases and resolution rates, and a focus on children with disabilities. In terms of improve reporting mechanisms, to establish more police stations and create anonymous online reporting platform for teachers, social workers, and community members. And this had come about after discussions around the concerns of the protection of persons who do come report and what other enabling mechanism could there be, and hence the suggestion around the online anonymous online reporting. Creating efficient management structures. That management has a responsibility to create efficient management structures to ensure resources are channeled towards frontline services rather than administrative overhead. And then finally, to improve collaboration and strengthening partnerships, having a clear model, collaborating with faith-based organizations and formalizing partnerships. In terms of resourcing, increasing the budget of Chapter 9s, providing particular support to additional leaders, increasing allocation for child protection programs. A key across both provinces was absorbing unemployed social workers into government departments, increasing funding for NGOs and ensuring 24 psychosocial support at TCCs, especially during weekends and holidays, having school-based child protection desks, increasing FCS and forensic staff, and then particular focus around the marketing of Childline and toll-free numbers and promoting that, and that requires funds in order for these numbers to be distributed countrywide. An NSP for children must be ring-fenced, and municipal funding with provincial and national auditing. The review of children's home funding processes to prevent closures of documentation and issues. And lastly, around enhancing training and capacity building, provide trauma-informed, multisectoral training for frontline workers, educators, police, traditional leaders to improve case handling and victim support. That traditional leaders also explicitly requested professional training to ensure mandatory cross-departmental training on statutory laws, obligations, and trauma-informed care, and a comprehensive teacher and nurse training programs. As I conclude, members and guests, As I indicated, in East London, the committee visited the TCC in Cecilia Makiwani Hospital, and that's managed and run by Massimaniani. They indicated they look at an average of 100 cases. Half of those cases are children. Often the children who come with a teacher or parent or caregiver would indicate and disclose that there are other children they know of that have also been a victim of abuse by the same perpetrator, that the Department of Social Development for this TCC has 2 social workers, but the social workers would only have 2 days on. So the first social worker does a Monday, Tuesday, and the next social worker does the other 2 days. A key concern is that their funding will end, their donor funding would end November 2025. This is Massimaniani. The last was the visit to the Cambridge police station. What members and guests see on the screen are pictures from the victim empowerment room. As you can see, the walls require paint. There were broken fixtures. The ceiling required to be redone. And what the police station had indicated is that the management and upkeep is done through Public Works. Chairperson and members, that concludes my presentation. Thank you.
Thank you very much, Ms. Abrams, for this comprehensive report. I think I just want to give some background before we get into the work for this morning. In a letter dated 10 September 2024, the House Chairperson for Committees, Oversight and Public Participation, Honourable Cedric Follick, informed the Portfolio Committee of Social Development, Basic Education, Health, Justice and Constitutional Development, as well as Police, of a referral pertaining to statutory rape of young girls. Broadly, the referral highlighted the occurrence of statutory rape and the harm that it causes, specifically mentioning adolescent pregnancy, as well as the lack of awareness by many victims that a crime was being perpetrated against them. The motion identifies the failure of certain persons in authority to report the crime to the police, despite being obligated to do so in terms of the Sexual Offences Act, as well as the Children's Act 38 of 2005, Section 110(1), and the failure of the responsible authorities to exercise oversight as being problematic. The referral required the relevant committees to confer with one another, to develop a joint public participation program, to receive submissions on the matter, to review the regulatory framework, and if necessary, recommend amendments to enforce mandatory reporting of statutory rape by teachers and nurses, and to report back to the House by the 31st of March 2025. Subsequently, given the revival and amendment of the motion, the Portfolio Committee of Women, Youth and Persons with Disabilities were included and assigned the lead committee. In addition, we are now to report back to the National Assembly on our initial findings by 30 November 2025. To this end, our Portfolio Committee with the Portfolio Committee of Basic Education, the PC on Health, and one member who also serves on the Portfolio Committee on Justice and Constitutional Development, just concluded our first leg of the engagements with stakeholders in Johannesburg and East London, and we've just received the report detailing the work that we have done there. I wish to again thank everyone that participated in that process, both from Parliament, government and civil society. The second leg of our stakeholder engagement and inquiry then formally commences this morning and entails Parliament shifting the focus to this crisis of statutory rape of our girls for the remainder of this week. We know that the Portfolio Committee on Health, Social Development and Basic Education will lead various engagements at Parliament this week. The purpose of this week's engagements at Parliament is to establish the prevalence of statutory rape of girls and to identify difficulties in this regard, to obtain a coherent understanding of mandatory reporting, and to determine what is required to enforce mandatory reporting of statutory rape, and in essence, to identify the gaps. Why are we failing our children? As I've said in our initial engagements, we are here this morning to learn from the experts. We are here to learn and listen so that we are able to report back to Parliament by the end of November on our findings and how do we strengthen the systems that are meant to protect our children. Honourable members and colleagues, I'm now going to hand over to our first group, our first delegation, which will be led by the chairperson of the CGE, Advocate Mogale, to make a presentation on behalf of the Commission for Gender Equality. I'm going to be very strict with time this morning because we have got many stakeholders that still need to present to us today, and we need to be fair in terms of making sure that all the voices are heard this morning. So each person, each delegation has been assigned 15 minutes, but that is the max. So if we can try and keep it to 10 to 15 minutes, we would like to appreciate that timekeeping arrangement. But I'm going to hand over to you, Advocate Mogale. If you can speak to the issues in our terms of reference, we would really appreciate it. And thank you very much for availing yourself to be here this morning. Over to you, Advocate.
Thank you, Chairperson van der Merwe, and thanks to the House Chair, honourable members, stakeholders, and fellow Chapter 9 institution, the Human Rights Commission. Chair, we have got 15 minutes only, so there shall be no opening remarks as well from my side, except to say all commissioners are here, except Commissioner Gumede, who is on leave, and Commissioner Tele, who has got a family emergency, and Commissioner Ngomane asked that he be allowed just to join a little bit later. He's stuck somewhere. So all the commissioners are here. We've got our team, the CEO, and Naledi Silabano, HOD of Research. So I'll hand over to Naledi. Thank you. Naledi, over to you.
Thank you very much, Chairperson. I've just realized that I do not have the rights to share. While I wait for that, I'd rather just go straight to the presentation, just in case we lose time along the process. I would appreciate being informed once I have the right so that I can then share the presentation. Good morning.
Sorry, you do have the rights now. Thank you.
Thank you very much. Thank you once more. Good morning, honourable members, Chairperson of the CGN Commissioners, colleagues on the call. I will be making this brief presentation on the CGE research regarding adolescent pregnancy, highlighting insights emerging from the study as it pertains to statutory rape. And I will also share a little bit around our current research endeavours on the subject. I'm sharing the time that I have with the CEO, so I hope to keep it very brief. So in 2023, the Commission for Gender Equality published a report titled Learner Pregnancy Policy Interplay, which focused on the school dropout of adolescent girls during pregnancy and in the postpartum period. The study aimed to investigate reasons for school dropout by adolescent girls during pregnancy and in the postpartum period, and explored the social, cultural, legislative, and economic factors that pose as barriers to school attendance by adolescent girls when they are pregnant and in the period once they've become mothers. The study also sought to explore the effectiveness of current institutional, legislative, and other efforts to protect and promote the right of education and non-discrimination of pregnant learners and adolescent mothers. And this was a qualitative study which was undertaken in 3 provinces, which included Limpopo, KwaZulu-Natal, and the Eastern Cape. And the study captured the views and experiences of adolescent girls. We also focused on senior officials from the National Department of Education, We spoke to school principals, educators, members of the school governing bodies, members of the school management bodies, as well as learner support agents. This was a broad study mainly focused on the school dropout of adolescent girls and young mothers. However, the report does cover aspects of statutory rape, older men, and teacher-learner sexual relations. However, this was quite limited. Hence, as CGE, we are expanding the scope, and I will touch briefly on that as I proceed with the presentation. Now, as it pertains to this issue, the findings noted that there is a provision in the National Policy on the Prevention and Management of Learner Pregnancy, which was adopted in 2021, that places an obligation on educators to report learner pregnancies of children under the age of 16 with a male person who's older than the age of 16 to the South African Police Service. And this also aligns with provisions of the Children's Act regarding the obligation it places on educators to report. But the findings revealed that some of the school officials that we spoke to indicated that while they understood the responsibility to report these incidents, they found it difficult to penetrate the secrecy surrounding the identity of the fathers, as engaging pregnant learners and their parents proved to be futile. In fact, a number of the educators we spoke to alluded to the financial gain that families stood to gain from by keeping this a secret and not reporting. Additionally, this was also seen as a family responsibility or family matter, wherein teachers were not expected to interfere. The study also revealed reports of male teachers engaging in sexual relationships or sexual activities with learners, which were mainly treated as rumors or allegations, resulting in very little or no intervention at all. The findings also showed that comprehensive sexuality education was rolled out inconsistently across the schools in the provinces, while sex talk was taboo in many households. Now, one of the dangers that parents seemed to be oblivious to concerning the avoidance of sex talk was that it laid fertile ground for older men to prey on and begin sexual relations with their children in secret. And in many instances, the parents would only discover the child's sex partner after uncovering the pregnancy. So it would only be in instances where the child and the parents engage on the pregnancy, where the parents would learn about the identity of the person responsible. In some instances, parents adopted an abstinence-only approach, which would be taught through moralistic injunction. And some learners came from child-headed households, while others lived alone in accommodations that were seen to be closer to the schools, with very little guidance, supervision, and support. Now, as members would realize, the scope of the study that I've just presented on is quite limited. It doesn't cover this full spectrum of issues relating to statutory rape. However, in the current financial year, the CGE is conducting a study on statutory rape and child marriages, and we place it within the broader context of sexual exploitation of minor girls. This study resulted from post-engagement sessions in relation to the study that I've just spoken about, involving various stakeholders, including members of this portfolio committee, who raised critical questions and concern around the identity, age, and relationship of the male individuals who are impregnating minors. The discussions also highlighted concerns about bystanderism, questioning the rates of reporting by educators and healthcare providers, as well as the frequency of arrests, prosecutions, as well as sentencing. The dialogues also highlighted that the Department of Home Affairs does store data related to live births, which indicates that indeed it is older men who are primarily responsible for impregnating children and adolescents. However, not much was being done to address this issue. As the CGE, we've also observed and received alarming reports regarding troubling practices, some of which are reportedly rooted in culture and religion. For example, in Mpumalanga, there is a concerning cultural practice which is known as Funelani Nganeno, which is reported to be in existence. This practice involves the arrangement of marriages or the sexual exploitation of young girls who are often offered to significantly older men in exchange for financial compensation. Now, these transactions can take form of lobola or dowries or other forms of monetary gain for families involved. In the Northern Cape, there are troubling incidents which have surfaced where vulnerable minor girls are being exploited and prostituted to truck drivers and older men. And these young girls, often caught in desperate circumstances, find themselves prey to the predatory actions of older men. But despite cases being opened with promises of protection and justice, many of these investigations are mysteriously dropped after the elders facilitating these exchanges receive financial compensation, effectively silencing the voices of the victims and allowing this disturbing cycle of exploitation to continue unchecked. In the Free State, we've learned of reports of sex trafficking of minor girls, which have been documented. The study employs a mixed method approach and also explores the understanding, knowledge, and attitudes of men towards the concept of the age of consent. The study also involves parents in understanding their role in the issues of statutory rape, including child marriages and the broader sexual exploitation of minor girls. We are also speaking to wider communities, including traditional and religious leaders, as well as civil society organizations, because we've also learned that the challenge is rooted in social and cultural norms regarding sex and the bodies of girls as well as women. The study also includes participation from the key departments, Department of Basic Education, SAPS, NPA, Department of Social Development, DOJ and City, Home Affairs, and this is regarding their roles and the effectiveness of their interventions. And the study is conducted in the Eastern Cape, Free State, as well as Mpumalanga in the Northern Cape. Now, Chair, there is unfortunately not much that I can share from this study since data collection is still underway. We do hope, however, that the study will offer key insights that will enable the CGE to come up with useful recommendations to address current challenges. But I must say, for this process, it is important for me to stress the following points: that strengthening mandatory reporting is important, particularly by duty bearers and key departments, as well as the protection of whistleblowers. It is important that victim support is offered and that there's access to justice, and that young girls do not bear the brunt or the blame of these situations. It's important that there is interdepartmental coordination, and there's also a need to address practices such as ukutwala and the norms that exist, as well as perceptions around the women's bodies as well as young girls. At this point, let me hand over to the CEO so that he can also take us through his presentation. Thank you very much.
Thank you so much, Naledi, and good morning, Chairperson and honorable members. I'll be very quick in terms of my closing remarks pertaining to the CGE. Chairperson, one of the things that we would like to submit before the committee is the need to intensify our advocacy campaigns to really deal with statutory rape matters that are unreported in society. And we make our submission following our stakeholder engagements that we held in Mpumalanga, following the allegations around Funelani Nganeno, wherein we now learned that the learners that were allegedly raped by family members as well as members of society were fearful to report some of these matters. There were learners that were alleging that there is collision that is taking place between themselves, the parents, as well as truck drivers going into the near countries. But they were fearing, Chairperson, to report such matters because the parents were obviously involved in such offences. And we resolved, Chair, that as CGE we are going to go on a campaign in Mpumalanga to meet a variety of civil society, members of the state, to really cajole reporting of such cases. We're happy to report that after our engagement, only 2 cases were brought forward. And what was alarming about one of the cases was that the perpetrator was the uncle to the minor child, and the mother was privy to the rape, and this child was raped almost on a daily basis because the parents were financially dependent on the brother in this regard, or the uncle. And then we also another one where a community member in the traditional sector was also accused of having raped a child constantly, but was able to provide financial support to the family, and therefore such matters were not reported initially. But after our stakeholder engagement, both DSD was on board as well as the South African Police Service. However, the learners, because they were in grade 12, they are in grade 12 now, they've requested that processes be held so that they finish writing their examinations, and psychosocial support is currently being provided by the Department of Social Development. Chairperson, we then came to a conclusion between the Commission for Gender Equality, the CRL Rights Commission, as well as the South African Human Rights Commission, that we need to come up with a strategy to really look at whether our current criminal justice system is able to respond to the issues that we deal with on a daily basis. By so saying, excuse me, we then resolved that perhaps an inquiry will be one of the things that needs to be done, wherein we have to interrogate the pre-trial stages to the extent which we establish whether these systems at pre-trial are able to deal with the day-to-day challenges pertaining to the handling of statutory rapes in society. We also felt that it's important to down look at the trial itself and ascertain to what extent Section 35 of the Constitution is being adhered to. And most importantly, also interrogate the post-trial stages, so whether the sentencing and the correctional services that are currently being embarked on are really ensuring that perpetrators are reformed and be able to be integrated back into society. Because we have observed that the same perpetrators that are now on parole, they recommit some of these offenses, and then obviously it makes society not to have faith into the system. So we are planning this inquiry, Chairperson, so that we are able to provide at least a way forward from an institutional perspective, but also from an advocacy perspective, Chairperson. We have also seen part of the work that we've done in Mpumalanga, as well as in Gauteng, that we have matters that are being withdrawn pertaining to statutory rape of minor girls as well as vulnerable persons in society, where dockets are being withdrawn without just cause. We were able to intervene, particularly in Palm Ridge Magistrate Court, where a docket was withdrawn, and the reasons for not withdrawing such case were not outlined. When we engaged with the NPA, they were also a bit surprised who actually was authorized to withdraw such a case. Upon intervention, Chairperson, the matter was reinstated. In our view, this therefore shows system gaps and lack of any M&E systems in place to track the live reporting of cases and the prosecution of such matters. Chairperson, with that being said, we'll say that with adequate funding to both CGE, Human Rights Commission, and CRL, the inquiry will really address the system failures and test once and for all whether we should be reforming this system, and if so, in what way or form. Thank you, Chairperson.
Thanks, Chair. That's our presentation. I just wanted to say Commissioner Gumede joined the meeting, so she is present in this meeting, and also to say as some commissioners are asking that they be released after our presentation. We've got plenary in 2 days, so everyone is running around trying to get their reports in. Thank you, Chair. That is all from us. Thanks.
Thank you very much, Chairperson Advocate Mogale and the CEO. We can definitely excuse some of your commissioners, but we'll have a question and answer session or a discussion session at 12:30. So we do need the CGE just to stay so that we can do that at a later stage before lunch or the lunch break. But thank you very much for that submission. We really do appreciate it. I'm going to then hand over to the South African Human Rights Commission. I think the commission is led by Commissioner Ntuli and Commissioner Kwinana, if I'm correct. If you can just introduce yourselves, and the same situation applies. You've got 15 minutes to make your presentation. Over to you.
Good morning, the Chairperson of the Portfolio Committee, Honorable Van der Merwe, all members of the Portfolio Committee present, members of chapter 9 institutions, civil society, academia, and everyone present. Thank you so much, Chair, for the opportunity. My name is P.D. Nduli. I'm a commissioner with the South African Human Rights Commission, and our presentation will be led by Commissioner Nomakobi Kwinana, to whom I hand over with your permission. Thank you so much, Chair.
Thank you so much, Commissioner Nduli. Thank you so much, Chair. And may I stand on the protocol that has already been observed. Indeed, I am with two commissioners, Commissioner Nduli, who has already spoken, and Commissioner Makwasha. And the other commissioners are engaged. It is only the three of us that are available. So I would like to share my presentation. I don't know if I do have yes. Chair, from my presentation, you will note that we have started by just talking to the mandate of the commission. As I think I am definitely preaching to the converted, but it is safe to say that we have been established in terms of Section 181(1) of the Constitution. We are an independent institution that is subject to the Constitution and the law. We are a Chapter 9 institution, and our mandate is threefold. It is to promote the respect for human rights and the culture of human rights, to protect the development and attainment of human rights, and to monitor and assess the observance of human rights in the public. In terms of our powers, which are found at Section 184(2), we are to investigate and report on the observance of human rights, take steps to secure appropriate redress where there has been a violation of human rights, carry out research, and educate. The Commission is also actively involved in ensuring compliance with international and regional human rights obligations by advocating for the country's ratification of instruments and their domestication and reporting on them. So the mandate of the Human Rights Commission, as I said, it is threefold and involves promotion. There we're looking at human rights awareness and education, community outreach, stakeholder engagement, portfolio committee briefings on focus areas, issues, engagements with all spheres of government. We also then have our other mandate, which is protection. There we then receive complaints, which we then handle. We do litigation. We go to mediation if that is the way to go, and inquiries if necessary, hearings, as well as subpoenas in the event there is resistance. We also monitor the human rights observance, and there we do unannounced and unannounced visits, and we ensure that the Commission has got footprint in all 9 provinces. And we also do have a motto that we adopted as of 2024, which is our rapid response mechanism for issues that could be in the public domain that have not yet been reported to us, but we become aware of. We also then are obligated to have a Section 184, subsection 3, and SOHR report that we must do. In terms of the issue that has brought us here, Honorable Chairperson and honorable members, the statistics of South Africa, Stats SA, show that 90.037 girls aged 10 to 19 gave birth from March 2021 to April 2022 in all 9 provinces. The report also indicates that of the almost 34,000 teenage pregnancies during 2020, 660 of those were girls under the age of 13 years. One of the root causes of those statistics is a crime called statutory rape. However, many people, including victims of statutory rape, have never heard of the term or don't understand it fully. This lack of knowledge contributes to a high number of unreported cases. Statutory rape is widespread and underreported. Statistics SA 2024, 20%, 100,000 children sexually assaulted versus 10%, 100,000 in general population. Many causes are only discovered during teenage pregnancy, underreporting, which then leads to justice failure. Sexual abuse of minors, especially statutory rape, remains a national crisis. This is shown in Stats SA's reporting. Despite strong laws, reporting compliance is extremely low. The goal should be to strengthen enforcement of Section 110 and 305 of the Children's Act. We know very little about the steps being taken by relevant professionals to initiate the reporting mechanism, emphasis, collaboration, or accountability. In terms of Section 10, all are supposed to experience human dignity. In fact, if one has to quote it verbatim, it says everyone has inherent dignity and the right to have it respected and protected. Whereas Section 12 then talks to freedom and security of the person. Everyone has the right to bodily and psychological integrity and to be free from all forms of violence. Sexual violence violates dignity and bodily integrity. Schools and clinics must be safe spaces. These sections provide constitutional basis for mandatory reporting that I've already mentioned. And may I hasten to also then mention that this applies to educators, to nurses, to doctors, to social workers, and really to everybody that has got contact with the minor children is expected to report. So, however, it is safe to say that really enforcement, as I've said, it's low. And in fact, if one can term it weak, it's safe to rather say it is actually very weak. Low levels of compliance are due to lack of awareness. This is what we have found out. The training that does not exist amongst professionals, whether we are talking about those in the medical space or we're talking about educators, or it could even be the social workers that are working with children. And again, there is fear of repercussions that exist amongst those that are occupying the space. there is really weak coordination insofar as the different stakeholders. And this we have seen with regard to the Department of Basic Education, Department of Health, Social Development, as well as SAPS, because from where we are sitting, Honorable Chair and Honorable Members, there must be collaboration between or amongst these departments in order for the reporting to be effective, or at least the enforcement to be strong. Poor data and monitoring of the systems exist. The results are really that there's no accountability, and unfortunately, the abuse continues to take place. So we have also then realized, Honorable Chair, that there are also pathways of reporting, obviously through the teachers, the nurses, but unfortunately, sometimes they themselves, they are the suspects in the very abuse itself. And the organization that is supposed to ensure that the reporting does take place, amongst others, it is the Department of Social Development and the SAPS being at the forefront. But of course, the child protection organizations, especially our civil societies that are supposed to be also, who are actually on the ground and are likely to have the information at first hand. So we have also noted that there's case backlog, and despite that there might be those that are investigated, but we also have realized that there are those that are falling into the cracks, and the children do not ultimately receive the protection and the support that is accorded to them in terms of the Constitution, in terms of all the laws that we have in the country. So each missed report is a child left unprotected. So it is safe to say that failure to report under Section 110 is a criminal offense, as enshrined in terms of Section 305, subsection 1C. Non-reporting undermines justice and protection system, accountability through disciplinary and criminal sections, which are essential. We have noted, Honorable Chair and Honorable Members, that underreporting is systemic and not isolated. Victims, often young girls, perpetrators, frequently known to them, focus on pregnancy rather than the underlying offense, data inconsistency, and poor follow-up mechanisms. And these are some of our observations as Human Rights Commission. We have received submissions on statutory rape and reporting compliance. When we, at the time, were doing, we had a focus area called gender, and I'm sure you recall last year that when we presented, we did mention that we have decided to let go of that aspect. But however, we still have a focus area of children, and this is where this does take shape. And Commissioner Makwasha will speak for a couple of minutes just on, as well as Commissioner Nduli, just on the work that we have done with regard to Ubutwala and some of the findings that we had observed. We are recommending, Honorable Chair, that the stakeholders that must continue with advocacy are CGE, the Department of Justice, SAPS, the Department of Education, Department of Health, Social Development, traditional and community leaders. We are also recommending that there must be a mechanism that we must develop insofar as monitoring compliance in terms of Section 110 and 305, and also that hearings must be held in order to deal with the barriers with regard to reporting, which can be brought to the fore. As we said, we do research, and this is where it can come out clear. We are also in agreement with what has been submitted by the Honorable Chairperson of CGE, Advocate Mokhale, to say that, in fact, there has been some work that we have agreed that we are going to be doing as a collective, and that has been informed by some of the cases that we saw did not end, in the way that one would have expected them to, that victims might not have received justice, and we thought we could look at it at a bigger scale to see what are these barriers, where are these shortcomings, in order to address them, to ensure that ultimately justice is realized for the victims. We are also of the opinion that there must be human rights education for professionals and communities. This is work that the Human Rights Commission has already started with and has been doing for some time. But it is safe to say that the work needs to carry on and we cannot stop. So the law does exist, Honorable Chair and Honorable Members, and say it must be followed. And of course, we must ensure that cases are reported. And we are benchmarking this against Section 28(1)(d), which says every child has the right to be protected and from maltreatment, neglect, abuse, or degradation. Honorable Chair, I still do have 4 minutes. Just in that 2 minutes, each one can share, Commissioner Nduli and Commissioner Makwasha, just to bring to the fore the work that we did for KZN, but also just a little bit on Ubutfala, if it is okay with you, Honorable Chair. Thank you so much.
Thank you so much, Commissioner. Let's give them 2 minutes each. Mpemba.
Thank you so much, Honorable Chairperson. Let me hand over to Commissioner Makwasha, and I'll come in after her. Thank you so much. Commissioner Makwasha, are you with us? Chair, while Commissioner Makwasha joins, then I'll go ahead in the interest of time, Chair. I'll be quick. Firstly, it is to thank the Portfolio Committee for having the wisdom to host such an engagement. It's also to thank the CGE for their presentation, which we fully support, and to also thank Commissioner Kwinana for her presentation. Honorable Chair, honorable members of the Portfolio Committee, when the founders of this notion of a national gender machinery imagined how we as feminists in the post-1994 would conduct the work of the women's movement, it envisaged that this would be within the framework and the auspices of this national or constitutional dialogue, which is a dialogue of accountability, particularly held by the National Assembly and the legislature in general, the executive, the judiciary, members of independent organizations, civil society and academia, and feminists across all of these nodes and institutions would create a platform under the national machinery to ensure that the work of the women's movement continues. And it's in that light, Honorable Chair, that we commend the Portfolio Committee for establishing this platform. We see it as a continuation of the work of the national gender machinery. And it is very important for us to frame it within that notion of a national gender machinery. We must also, Honorable Chairperson, thank the National Assembly for declaring this issue as an emergency, because it is through this declaration that when we are able to prioritize such hearings, we can create and strengthen our oversight mechanisms, and we can also sharpen our monitoring tools to address this very serious issue. It also, of course, as mentioned by previous speakers, provides a leverage for us to fast-track legislative amendments. And this has also been emphasized by Commissioner Kwinana as well as the CGE. And lastly, Chairperson, it demands an all-of-society approach. It's very pleasing to see the program today that it's not just Parliament, it's in conversation with all of society in ensuring that we have an all-of-society approach to addressing this issue. So on our side is to thank you, is to commend you, and is to frame this within the auspices of a national gender missionary so that we continue the conversation at all levels of society and wherever this issue finds itself. Thank you so much.
Thank you very much, Commissioner Ntuli. Let me take this opportunity to thank both the Chapter 9 institutions for your presentations. We do fully agree that we need an all-of-society approach to deal with this crisis. So thank you very much for your time this morning. Please do stay with us at about 12:30. We will have some discussions before a short break. I'm going to hand over to the Sexual Reproductive Justice Coalition. If you can just introduce yourself and also just please stick to your 15-minute time allocation. I've also been informed that this meeting is being broadcasted live on Parliament's channel 408. So if you are able to switch on your cameras, please do so. Over to you. Sexual Reproductive Justice Coalition.
Honorable Chairperson and members of the committee, good morning and thank you for this opportunity to present on behalf of the Sexual Reproductive Justice Coalition. My name is Peterson and today I speak on behalf of a collective that brings together feminist scholars, activists and practitioners, including Professor Catriona McLeod from the Critical Studies in Sexualities and Reproduction Unit of Rhodes University, and also Ms. Judy Ranapa from the Western Cape Department of Health, who together have contributed to the submission. We truly appreciate this opportunity to be engaging the committee on an issue that deeply affects adolescents and children in South Africa, namely the legal framework governing statutory rape and mandatory reporting and how this then intersects with adolescents to access to sexual and reproductive health rights. As outlined in the Children's Act and the Sexual Offences Act and the Choice of Termination of Pregnancy Act. As the SRJC, we want to begin by affirming our commitment to ending sexual violence and protecting children from exploitation. However, we also recognize that the implementation... Sorry, my laptop moved. We also want to recognize that the implementation of mandatory reporting in cases of statutory rape presents serious and unintended challenges, and particularly when dealing with consensual sexual activity between adolescents. Section 54 of the Sexual Offences Act makes it mandatory for any person with knowledge of sexual offence act against a child to report it to the South African Police Service. While this provision is crucial in addressing abuse, but it also creates a very complex ethical and practical dilemma in the context of adolescent sexuality. When a 13 or 14 or 15-year-old seeks healthcare for contraception or even antenatal care or abortion, healthcare providers are then placed in a double bind. They must both build trust and confidentiality with the adolescents, but that confidentiality or even break that confidentiality through mandatory reporting. This then undermines that relationship of trust needed for effective care and then also discourages adolescents from then further accessing critical SRHR services. It is also essential for us to note the nuances in the law. Adolescents aged 13 to 15 may legally engage in consensual activity with peers within a two-year of age gap. But yet the policies that the Department of Basic Education in its learner pregnancy policy, it fails to reflect this. And we then say this leads to false criminalization of consensual relationships between young peers. And it's very important then to note that this misinterpretation results in unnecessary police involvement, further stigma and fear of all, which drive adolescents even further away from healthcare services, and also undermines the public health objective, including those related to HIV prevention and maternal health. Research has shown us that young people already face judgment, stigma, and confidentiality breaches when seeking SRHR services. So for us, it's the fear of reporting to the police then yet adds that other barrier, pushing adolescents even further away or even delaying to avoid healthcare altogether. This also leads to the increased risk of HIV infection, unintended pregnancies, late or even no antenatal care among pregnant adolescents, reluctant to seek safe and legal abortions, and in many cases even worsened mental health outcomes. And that is basically due to the fear and shame of trauma. We also cannot ignore the economic and social context in which statutory rape often occurs. In many communities, adolescent girls enter a coercive or even a transactional relationship because of poverty, family instability, or even just limited educational opportunities. In such cases, when reporting the perpetrator, who may then also be the breadwinner, this then can place, that the survivor and the family in further economic distress. And many adolescents then therefore, they just choose to be silent over justice. We must therefore recognize that statutory rape is not only a legal issue, but it is a social and structural one, deeply tied to gender inequality and poverty. Too often, the current system places the spotlight on the girl child, but rather than on the men and the boys who perpetuate the exploitation. Preventative programs that challenge toxic masculinity, like Men Engage, are very vital. Such programs must be scaled up, and they must be funded, and they must be integrated into national efforts to combat gender-based violence. We shift from criminalizing adolescents and to holding perpetrators accountable, while providing young people with a safe space, education, and support. Therefore, the SRJC strongly recommends that reporting protocols must be person-centered and trauma-informed. This means that we should look at the adolescent girl and prioritize her well-being before anything, and that before the report is made. And her healthcare needs, including sexual, reproductive, and mental health, should also be attended to first. The law must be clearly explained so she understands she's not to blame, she's not in trouble, and that she has the right to support and care. Where the relationship is consensual within this 2-year age gap, no report should be made, but the girl should be referred to youth-friendly SRHR counseling. Girls should never be pressured to name perpetrators. Rather, trained social workers should seek collateral evidence to avoid re-traumatization. We also say that all professionals, teachers, nurses, and social workers should receive training on adolescent-friendly and non-judgmental engagement. Therefore, in summary, the SRJC calls for policy alignment across all sectors to ensure correct interpretation of the Sexual Offences Act and the prioritization of trauma-informed, person-centered care. The inclusion of the Sexual Offences Act in the comprehensive sexual education so that learners would know their rights and understand the nuances of the consent, and they are assured they will not be punished for seeking help. There should be more emphasis placed on public health campaigns that educate communities, especially men and traditional leaders, about their responsibilities to prevent and report sexual exploitation, making social workers the first point of contact for reporting statutory rape. This is just in system, scaling up preventative programs for men and boys, and challenging patriarchal norms that sustain sexual exploitation and violence. In closing, Chairperson and members, our laws must protect adolescents, not punish them for being sexually active or seeking care. We therefore urge Parliament to ensure that implementing of mandatory reporting does not unintentionally criminalize or even further endanger the very young people it seeks to protect. Let us build a system that is compassionate, evidence-based, and rights-driven, on that promotes access to care, prevention of violence, and the realization of sexual and reproductive justice for all. Thank you so much.
Thank you very much, Ms. Peterson. We appreciate that succinct input. Can I then hand over to the School of Education at the UKZN, Dr. Lisa Wibesik. I hope I pronounced the surname correctly. Over to you, Doc.
You did. Thank you so much. Can everybody see my screen?
We can.
Thank you so much for your time this morning, and good morning, Honourable Chair, Honourable Members and respected colleagues. I'm the research manager of the Centre for Visual Methodologies for Social Change in the School of Education at the University of KwaZulu-Natal. And although the research that we do is not educational research in its traditional sense, most of our work is in and around schools, and especially rural schools and communities. So what I present today is qualitative in nature. It's a sociological understanding of the phenomena that we're talking about, and hopefully it's the sort of work that can provide a narrative behind some of the statistics and a possible approach to contributing to addressing some of the issues we're talking about today. So it's well established that schools are microcosms of the communities and societies in which they're located. The social relations that are produced and reproduced in and through schools both reflect and reinforce those that are dominant in communities. Importantly, this dynamic includes unequal gendered power relations, norms, and expectations that shape people's lives and experiences, including sexual violence that takes place in and around schools, and is a reflection and reproduction of the gendered violence that's endemic in South Africa. This violence is exacerbated by material and structural conditions such as poverty. Gender-based violence in and around schools is perpetrated by peers, teachers, school management, providers of scholar transport, and others. And in many cases, schools are not safe spaces for children, especially girls, who are vulnerable in a number of intersecting ways. Based on unequal gendered power relations related to age and gender, which are a key concern. However, importantly, schools are also key sites of intervention. Teachers are often on the front line in terms of disclosure, and they are places where consent can be taught and practiced. So to effectively communicate about the research I'm going to talk about this morning, I just need to give you a bit of a background about the work that we do at the Centre. So we do community-based participatory research, particularly participatory visual methodology, which involves using visual and arts-based methods to aid our participants with communicating about sometimes sensitive subjects. Importantly, we work with participants and communities. We recognize them as experts in their own lives and experiences. And we focus heavily on learning from their perspectives about the phenomenon that they are experiencing. So the aim of this kind of research is research as intervention. We try to co-develop deeper and more nuanced understandings of challenges and issues, and to co-develop strategies to address them. So it's part of a long-term process, part of which is stakeholder engagement, and that includes engaging with communities, policymakers, practitioners, etc. Because this work is researchers' intervention, it also then can offer a way of contributing to addressing these sorts of issues, particularly sexual violence, including statutory rape. So it also gives us answers to questions we didn't know to ask. So, for example, we ask why girls are getting pregnant instead of who's impregnating them. And these perspectives are offered by our co-researcher participants. I'll be drawing quite heavily on two projects as sort of case studies. These are recent projects that we've done in a community in the central Drakensberg region of KwaZulu-Natal, where we've been working since 2016. Based on these projects, other work we've done, and the literature, I have two focus areas for the discussion this morning. Those are Ubutwala and comprehensive sexuality education, or CSE. So for our first case study, in our very first workshop with our 15 researcher participants, who were all girls aged between 15 and 19 at the time of recruitment, they identified early and forced marriage as one of the key issues affecting girls and young women in their community. And what they called what we're talking about is very important. In English, they would use early marriage, forced marriage, and early and forced marriage. They would also use those terms interchangeably with ukutwala. In isiZulu, they would speak they would only use the word ukutwala, sorry. So I'll pick up on this again in a minute. So what we learned from our girls is that from their perspective, marriage is highly valued in communities with substantial social rewards as an essential to the performance of successful femininity. It's encouraged by parents, especially early marriage, and also by peers for this reason, and also for the material and structural drivers of early and forced marriage, including endemic poverty and a lack of educational and employment opportunities. So by parents, it's often seen as harmless, even beneficial for the girls and young women to secure a good future for them. Coercion is central to these practices. So it's not just violent physical force involved in ukutwala, but from the girls' perspectives, pressure from others, including parents and peers, to relieve financial pressure on families through access to lobolo. And it most often involves age-disparate relationships. So it's very rare that the age gap provision for consensual relations between adolescents over the age of 12 applies in these cases. So we've heard accounts of girls as young as 12 being married. There is an event called Ukuphuma Kwezintombi that takes place at a place called Egangeni, which happens every second year. So girls as young as 12 can, on this day, sometimes leave with the much older men who are going to be their quote-unquote husbands, with the permission of their families if the lobolo negotiations are successful. So statutory rape is heavily implicated in ukutwala and early and forced marriage in these communities. There's also a sense among the girls that sexual violence, including ukutwala, is inevitable, which is a particularly sad finding. So the key influences identified by the girls that sort of drive ukutwala or EFM include ideas about culture, involve lobolo and uguhlonipha, so those age and gender-related power relations I mentioned earlier. And also the sphere of influence and application of customary law, which remains unclear for a lot of people. This includes things like nhlawulo being used to resolve issues around statutory rape, early and forced marriage, which leaves girls feeling like they have not had justice and they feel commodified and undervalued often. So obviously, consent is very important here. So there's the legal definition of consent, but there's also a social or an ethical definition, which involves ideas about consent being something that is required, and also how to do consent in real life, which is not always something that we talk about. It also requires that both boys and girls learn that boys and men are not entitled to girls', women's, and children's bodies, and that consent is something that they should have the right to give. So before we even talk about what it is, we need to talk about the fact that it is something that people should have the right to do. So ukutwala takes place at the intersections of modernity and culture, and of these two systems of law and justice that coexist in South Africa. There's also a language issue that we'd like to draw attention to this morning. So in English, we can refer to early and forced marriage, but in isiZulu, there is one word for the practice. Ukutwala, it refers to two things. It refers to a historical practice, which is a remembered practice, and it's not consistently practiced across space or time, but essentially it is consensual and doesn't involve violence, and it does not involve children. The second meaning of the word, of course, is crimes against girls who are abducted and sexually assaulted, not always even forced into marriage, but sometimes forced into customary marriages under the guise of this historical kidnapping, which then lends kind of an air of legitimacy to these crimes, as we saw in the appeal of the case of Jezile versus State and others, where he used the so-called cultural defense to claim that his abduction and sexual assault of the 14-year-old girl who was his victim was part of ubutwala. So there are other phrases that have been suggested and or used over time, including ubutwala Ntombi, which refers to the historical practice, and ubutwala ngengane, which refers to the crimes against girls. There's also the option of using the English phrase. Ubutwala as a historical practice can't be criminalized because it is associated with the legitimate practice of culture among the Amaxhosa and Amazulu peoples. But EFM is illegal, and it can and should be more aggressively pursued. So in this particular project, we used a process of community-based policy making, which involved community engagement meetings, community dialogues, and working closely with stakeholders to co-develop a reporting and response protocol to address EFM in this community. Unfortunately, due to COVID and funding issues, we've not yet rolled out the protocol, but we had a meeting just this last Friday with the new Nkosi in the community about plans to roll it out. And we are developing a project also to explore the possibilities offered by language change around ubutwala versus EFM. The second sort of case study is around comprehensive sexuality education. This particular project arose out of the project I've just spoken about. CSE has been part of the curriculum of all government schools since 2000. It's integrated into the life skills and life orientation curricula. But since its introduction, it's been beset with challenges myths, misunderstandings, misconceptions, etc. There's widespread public objection when CSE comes up in the media on religious, cultural, and moral grounds, including concerns that CSE doesn't align with traditional norms, values, and expectations, including gendered expectations about virginity, abstinence, and shame. So the need for CSE is really well established, particularly in South Africa. One of the biggest challenges is that talking about sexuality, sex, and relationships is taboo and is blocked often by ideas about age and gender and respect, ideas about girls' innocence and compliance. So what we know about CSE, so the objections are in spite of what we know about CSE, which is very well established, that it encourages later sexual debut, it results in a reduction in intimate partner violence among adolescent partners, but also in age-disparate relationships, an increase in safe sexual practices, reductions in unplanned and or unwanted pregnancies, a reduction in incidence of HIV and other STIs, increased retention of female learners in schools, and a move away from destructive gender norms and expectations. The challenges and loopholes have been quite well researched, and they are fairly consistent. There's a lack of pre-service and in-service teacher training, a lack of resources. Teachers lack knowledge and confidence for this reason. There's a failure to prioritize life skills and life orientation because of pressure of the timetable and prioritizing other subjects. And teachers have personal reasons not to teach CSE, including culture, religion, personal morals, values, and beliefs. In response to this, we co-developed a CSE toolkit with 3 sets of co-researcher participants, including parents, teachers, and learners from 2 high schools and 2 primary schools in 1 community. And it's been very useful as a resource to facilitate conversation between adults and children and young people. It challenges the shame around sex and sexuality. It challenges taboos and silencing around sexuality, and also about violence. And it provides essential facts about things like the legal age of consent, social and ethical definitions, and the doings of consent in real life, identifying different kinds of violence, and also abuse, including, really importantly, grooming and coercive control, which are things that we don't talk about. They're not very present in public discourse or in a lot of the research on comprehensive sexuality itself. Importantly, it also touches on unhealthy relationships versus healthy relationships. So young people know what to look out for. They know what to report. They know when something is dangerous. The toolkit's been developed first in isiZulu, which is the first of its kind. We've had a lot of input on the language from our co-researcher participants so that it is accessible and responsive and reflexive. And so what works? We think community-based policy, participatory research and policy making, working with community, has a lot of potential, especially for its ability to draw people in rather than to call them out, and to help to avoid clashes between ideas of modernity and culture, which only serve to alienate communities. It's also a way of being very respectful of people's culture, heritage, and custom, and acknowledging that the two need not be mutually exclusive as we work to transform gender relations in the country. It also is important that we note that at the rates that we see it, sexual violence is a social pathology, not necessarily only an individual pathology. So it requires a social solution in terms of both prevention and access to justice and care. Time, we need time. Social change is a long-term project, particularly with very entrenched things like gender. And so our wish list includes things like a lot of accountability. We need both the Department of Basic Education and teacher unions to be held accountable and to hold teachers and schools accountable. So instead of perpetrators being moved to different school circuits or districts, they really need to be prosecuted and be unable to teach in the future, be around, well, near children. We need clearer guidelines on mandatory reporting. We need the Department of Basic Education and DHET to address issues with teacher training. And also we need to do more work with the leadership structures of traditional communities so they understand where these issues should sit in relation to the two systems of law and justice that coexist in the country. We urgently need access to resources, particularly in rural communities, including first-line responders. We need tutela care centres urgently in rural areas. And CSE is an absolutely essential intervention to address issues of sexual violence and statutory rape. And to touch on something that others have already mentioned a number of times this morning, we need to work with traditional leaders and customary law on the application, implementation, and access to justice for girls and other children affected by statutory rape, gender-based violence, especially sexual violence. Thank you so much for your time.
Thank you very much, Dr. Lisa Wibesik. We really appreciate your presentation. In fact, during our first leg of our hearings in Johannesburg, we did hear about a lack of resources such as social workers, critical lack of social workers, not enough boots on the ground. We heard of a lack of resources for our NGOs who provide vital services on behalf of the state. But we also heard, as the earlier presentation indicated, of a lack of coordination between the various role players, which you've also highlighted, and a need to involve traditional leaders in all our efforts. So thank you very much for that submission. I'm going to move straight to the Executive Director of Lifeline Rape Crisis, Ms. Biela. Over to you, ma'am.
Good morning, Chair. Thank you so much, and good morning to the colleagues online. Madam Chair, I tried to share, and it says host disabled participant screen sharing. So I'm not sure if there's anyone that can share my presentation on your side. I think we had given it to Mr. Dumezweni.
Mr. Dumezweni, please assist.
Sorry.
Okay, Chair.
In the meantime, I think while we're waiting for the presentation, in the interest of time, Madam Chair, through you, may I request that I do the presentation with my chairperson of the Lifeline board, Dr. Sway Fapamji. We'll be sharing my presentation, we'll be sharing the presentation time together. I will be presenting on the background of the work, of our work as Lifeline in Red Crisis, as well as the best practices. And then the chairperson of the board of Lifeline will take us through the recommendations based on our work. We, as an organization, Lifeline Pietermaritzburg, that is our legal name, but we're trading as Lifeline in Red Crisis. We are based in Kumandava districts, and we work in 5 districts within KwaZulu-Natal, which is Herkwala, Umgumundlovu district. Our work mainly, we do a lot of work around sexual reproductive health and rights with young people. We do also work with them in terms of HIV and AIDS, and working with children that are vulnerable and that are also orphans. Our work is actually, the core of our work is around counseling services that we do provide. We do a lot of work on the gender-based violence and femicide. We have staff members stationed in hospitals and crisis centers, in Tutuzela care centers, and in victim-friendly rooms within the police stations in KwaZulu-Natal. I think we are in 34 police stations. We also work closely with safe houses where women and children do get placed in if they are survivors of gender-based violence. We do work around training as well as economic empowerment, where women get trained on soft skills so that they can start their own businesses. All of this together assist women and children to be emotionally well, and because our vision is emotionally well individuals and communities. So through this work, we try and make sure that communities are actually emotionally well. I'm looking at Mr. Dumezweni, if I could share now the presentation, Mr. Dumezweni, because we're going to be looking at now the problems and the trends that we have identified as Lifeline working in the space of gender-based violence. I think what we have noticed in many communities, as I said, we're working in 5 districts, we have noticed that statutory rape is a silent crisis in South Africa. On a yearly basis, we see numbers that are being presented in terms of children that are pregnant or that have given birth in different government hospitals. And for us, that statistics that gets presented, it's not just a number, it's children that their future is being ruined because they've become parents at a very tender age. So for us, it is a big crisis because year after year, the statistics keeps increasing of children that have become parents when they are young themselves. In the last financial year, Lifeline has supported about 727 survivors of statutory rape alone. So this is not talking about other rape, this is just purely statutory rape. And out of those children, of course, a number of them were pregnant young girls. And as an organization, we are saying pregnancy of a young girl is potential evidence of a crime that has been committed to their child. And we are saying children are actually having children, they are being robbed of their childhood, but ultimately they're being robbed of their future as well. So we have come across cases when we work with children where educators that are working in schools have actually sexual relationships and have impregnated girls in high schools. And this is very actually concerning because those educators, they're supposed to be the people that are protecting children. Can we go to a slideshow? Thank you. So I will just skip. Can we skip and that one as well? Skip that one, there we there. So I was just saying, we've seen cases of educators. Go back a bit on one slide. We've seen cases, yes, that's one, thank you very much. We've seen cases where young girls have been impregnated by all the teachers and nothing is happening in the schools. And there is a big concern of the age gap that we have seen. We've had cases of a 13-year-old being impregnated by a 49-year-old man. So you could see that actually these people are just predators. But also what we have seen in our work, we've seen the new trends as well, where boys that are between the ages of 14 have reported that they are watching porn and now they're reenacting sex, but with girls that are under the age of 9 or that are 9. And they're saying they're doing that because they don't want to make these girls pregnant. So for us, it's very concerning because then it shows the level of understanding of sex already at that very tender age. But also it's an indication of the importance of not leaving a boy child behind as we deliberate on these issues and trying to find solution to this crisis. The boys are actually the central part of the conversation as well. Next slide, please, Timezeni, on the key issues and concerns that we have identified as Lifeline Peace and Respect. We have noticed that communities, government system, and when we say communities, we're talking about all of us, that basically we have failed our children because they're young, they're dependent on all of us as adults to protect them. But clearly we have failed to protect them. One of the concerns is that institutions that also are supposed to be the forefront of protecting them, whether those are South African police services, whether it's government hospitals, DSD, NPOs or child protection organizations, and other community groups, they seem to be working in silos. And when they work in silos, there will be no solution that is going to be found into this problem, because this problem requires a collaborative effort, not people to work in silos. But also what is the biggest concern, girls suffer a lot of complications during pregnancy and at times during delivery because their bodies are still very tender and they're not matured enough to carry another life. Also what we've seen working with girls, they do suffer postnatal depression after delivery, and normally there is no support. They go through the journey alone without any support. And it's important that we note this point, because when we talk about mandatory reporting, when somebody is depressed, they're not even going to be looking at reporting this case because they have no interest at all. And of course, they are unable to complete school because nobody wants to look after their children. And financial dependency it's a big issue because they can't raise these kids on their own. They're young, they're unemployed. What we've also seen in communities, can we support young children that have fallen pregnant or that are actually victims of statutory rape? Sometimes they end up residing with the boyfriend's family and become young makotes, not because they willingly wanting to live with the in-laws, but their own families have kicked them out when they realize that they're pregnant. They get told, go and live with that boy or that person that had made you pregnant. And indirectly that forces them to become young makotes and actually to drop out of school completely. When we do home visits to check on these young people, we found them in the in-laws side of the family. And this is very important because once again, if you want this young child to lay a charge or to open a case, how are they going to open a case when they live in the family of the man that had impregnated her? So it just becomes extremely complicated. It increases the infection rates in terms of HIV because they can't negotiate safer sex when they're dealing with an older person. But also what we have noticed it is in a way now the cycle continues of young mothers becoming young grannies, and it just continues nonstop. I've seen a granny that is 32 years old, that is actually a granny. And when you start calculating, you are a granny at the age of 32. It means probably you fell pregnant when you were about 15. And now your child around the same age has also become pregnant. So this is actually a very, it's becoming a pandemic. Next slide, please. Thank you. And then in terms of issues around mandatory reporting that we have noticed as Lifeline, we have seen that there is the core is the lack of accountability with all the people that should be protecting children, whether it's child protection organizations, whether it's SAPS, whether it's social workers, nurses, doctors, there is no accountability. And another problem is entrenched in social and cultural norms in the communities. And the previous speakers have alluded to this as well, where you could see that the problem, it's deeply rooted in the cultural norms. And we need, while we deliberating on the mandatory reporting, we also need to determine which cases ought to be reported because and to whom these cases should be reported to, because it's not all cases, for example, that we believe needs to go to SAPS, because SAPS is also running short of resources themselves. We really need to sit and say, if we have to do what is in the best interest of the child, is it only SAPS or are there means of reporting the cases? For example, if there's sex between adolescents, if they both 14 and a girl and a boy, do we have to report it to SAPS or do they need a different intervention? And yes, there is sex between adults and a child that definitely needs to be reported. And what are the barriers of identifying the perpetrators? Because we have the laws, and laws stated clearly that statutory rape, it's a crime and people need to be taken into task. But what are the barriers? Things like patient confidentiality, fear of perpetrators and financial dependency, and all these things, SAPS refusing to open cases, families not reporting. But the big one for us is the complainant or victim non-participation in court processes. Sometimes children themselves, they refuse to participate in court processes. You'll open a case, and they will not go give a statement, or they run away when they need to go to court because they want to protect their boyfriend or their partner. In terms of the best practices, what we have seen as Lifeline is that the multi-stakeholder initiative is key. So we feel that we have done advocacy, that we went into Parliament in 2022 as well as in 2023. That resulted in Department of Health giving a list of teenagers that have presented in their facilities that were pregnant and they were underage. So this is a pilot project that is done by Northern Hospital as well as Edenvale Hospital. So far, we've seen 80 cases that have been reported to us. But what is key that I want to mention here is the provision of psychosocial support during pregnancy and delivery. That allows a teenage mother to finish all the antenatal visits without fear of the partner being arrested. And we promote do no harm, where we need to protect both the mother and the unborn baby. And if you provide them with counseling, they will eventually see that their rights were violated. And we do conduct home visits to maximize support from home. And then when the child is mentally ready and emotionally ready, we assist them to open cases. And through that model, we're seeing less case withdrawals when support is given and they are not coerced. I'm going to hand over to my chairperson to also take us through the recommendations that we would like to put forward as Lifeline Personal Respect. Thank you. Over to you, Boss Lady.
Thank you, colleagues. So if you could move to slide number 8. Thank you. Yes, that's perfect. Slide number 9. So we're just going to very quickly go through some of the recommendations based on what we've said so far and what very many other speakers have said. I think, first of all, before we talk about improving mandatory reporting or changing mandatory reporting processes, it's important for Parliament, through discussions with organizations like ours and all the very many organizations that are here, to determine what the purpose of mandatory reporting is. Because upscaling it is just not simply going to do the trick, as many speakers have said. It might, there already is legislation and law in place for reporting. Consequences for not reporting are clear as well. So it's determining what it is meant to do. And once we know what it's meant to do, then we can better align what processes are. As far as we're concerned, the purpose of mandatory reporting is to alert suitable bodies, and more than just the police services, but suitable bodies like organizations like Childcare, Lifeline, etc. And the purpose there being to initiate investigations before further abuse occurs, and that will help us inform a targeted response, as well as prevention strategies and standard operating procedures. It will help reinforce state as well as community obligations to protect children. It will also encourage accountability and prevent cover-ups. But again, the key thing is, what do we want to achieve with mandatory reporting? Beyond that, at a grassroots level, we find that there must be an awareness created at community level. Dealing with the issue of statutory rape is not going to be a top-down solution. In other words, more legislation and more law from the top all the way down to the bottom is not going to fix the problem. It has to be a bottom-up approach, which means using your community platforms, radio stations, schools, churches, community halls for a holistic educative response, largely in this particular moment focused on educating boys, men, and leaders to promote respectful relationships and challenge harmful norms of behavior. Again, going towards educating young men and boys to teach them respect, responsibility, legal awareness, reminding communities that girls don't get pregnant on their own. Next slide, please. And then also hand in hand goes economic empowerment of young girls and women. As stated, very many speakers today have said that some girls stay in relationships or engage in relationships for some sort of financial benefit. And what we work on at Lifeline is female financial independence and empowerment through various of our sort of upskilling programs. It would be skills training, education, and it will help provide financial independence. It will then also improve your outcomes related to gender-based violence, and it can also improve community development, because if you've got an empowered woman, you've also got now empowered daughters, etc., and empowered young men flowing forward. Beyond that, we also want to look, we can't ignore the fact that there must be prosecutions, obviously on case-appropriate prosecutions, and that will also then not only of perpetrators, but those who are complicit. And as far as the legislation is concerned, in terms of Section 54, a person who is complicit is someone who has a suspicion, even just a mere suspicion, that a sexual offense has occurred, fails to report. So the purpose there would be holistically then to protect children effectively, uphold legal as well as moral standards. It would require specialized training for prosecutors, as well as the police services. It would maintain public trust and institutional accountability, particularly where families, other victims feel that there's no justice or nothing is being done. And to also help us deal with resistance from within cultural norms as well as institutional resistance. As far as this platform and local government or national government and NPOs, etc., it is necessary to hold government departments and NPOs accountable for what is being done in terms of the broader GBV response. Next slide, please. We would also call for quarterly reviews and accountability, and that helps get timely feedback loops, enhanced alignment with data-driven decision-making. Continuous improvement also comes from that. It provides structural oversight, responsiveness, etc. Funding and resource allocation, which is always a problem, but if we're looking at a holistic method where different organizations and different platforms and different ministerial bodies are working together rather than against each other in silos and with competing interests, then the money can be better spent based on a collective goal and a collective vision. And again, training of SAPS as well as teachers in colleges as part of the college curriculum, but also as part of continued professional development. Next slide, please. So based on these recommendations, we've come up with a proposal for the reporting. And the key question is the SAPS always the best place and the only place to which incidents of sexual violence or statutory rape should be reported to? Now, currently in the legislation, that is the body that should be reported to. But unfortunately, from our experience at Lifeline, we find that that is not always the best, because it does, there are very, very many challenges with South African police services. And when we go back and we think about what was said by the Sexual Reproductive Rights Coalition as well, this fear of criminalization for the girl herself or for the learner themselves, as well as for their partners, their older partners, or even if it's the same age partner, becomes also a major hurdle. And the truth is that who would be recipient of an initial disclosure or have a suspicion? It's likely a teacher, a doctor, a nurse, or any adult who receives a disclosure or suspects abuse. And then from there, it should be channeled through to a social worker or a social body, something like Lifeline, Childline, etc., because those social workers are better skilled to do that. And for the teachers and the doctors and the nurses, doing that, making the report to where we say a social work organization is better placed to be your first port of call, except of course in more critical cases, then that will have better case retention, etc. And then what you're looking also then is towards a multidisciplinary case review, which includes social workers, psychologists, child protection officers, medical professionals, etc. And go to the next slide, please, just in the interest of time. Step 4 would be referral to police. Now, step 4 is interchangeable depending on the nature of the harm that is visible, immediate. It may be necessary to go first to the police, or it may be that families go to the police first, okay? But there too, the police need to have certain training. The social workers then can also, if the report was made to them initially, determine whether the police brought forward in the process is also necessary. But what is important for our current discourse is that the SAPS, as currently legislated, should not be the body or the first call. There should be some sort of discretion and leniency there. And that's, in our opinion, where the reporting obligation should be more nuanced. And then when, through therapy, etc., through proper investigations, when the victim of this form of abuse is ready, and that comes through counseling, through showing a protective and trusting environment, when they are ready to bring a case on their own, because it's important that these cases are brought, in a sense, voluntarily rather than in a coercive way, so that cases aren't withdrawn and that the witnesses and the victims do give testimony. We must continue to offer therapeutic as well as legal support. So I think that wraps up our presentation from Lifeline Peter Maritzburg. Thank you all for listening. Oh, sorry, just one more slide. I thought that we were done. Why this model works in our experience: it does minimize trauma, it ensures support, it can improve outcomes, and whatever the outcomes are, immediate outcomes would be health concerns, STIs, young pregnancies, all the requirements to ensure that you get holistic healthcare, as well as the driver for change, which may well be through the legislation, through the courts processes, depending. And then ultimately it respects discretion from the healthcare workers as well as the social workers to make or assist this young girl in making the right choice, what is best for her based on her needs and her socioeconomic circumstances. So thank you again for that. Yes, thank you for your time.
Thank you very much to Lifeline. And thank you very much for your proposals, your inputs and your recommendations. And thank you also for the work that you are doing in our communities in KwaZulu-Natal. I'm going to now ask the next presenter from the Centre for Child Law, the University of Pretoria, to take the floor, please.
Thanks, Chair. Unfortunately, I don't think I have permission to share my screen, but in the interest of time, I think I will just comment. But I did send my presentation last night to colleagues. Oh, Thank you. There it is. Okay. Right. Can everyone see my screen?
We can, yes. Please proceed.
All right. Thank you very much. Thank you very much, Chairperson. Good morning to everyone, honorable members, colleagues, and fellow stakeholders. Thank you very much for this opportunity to make these submissions on behalf of the Center for Child Law. My name is Fortune Saneka-Mwai, and I am an attorney at the Center for Child Law. We at the Center for Child Law, we welcome this engagement and values Parliament's oversight role in ensuring that South Africa's laws as well as institutions uphold the constitutional promise that every child has the right to be protected from maltreatment, neglect, abuse, and degradation. This is something that has already been echoed by many colleagues today in their presentations. So, Center for Child Law, we are a child rights and child law center strategic litigation organization that was established in 1998. We are also registered as a law clinic with the Legal Practice Council, and we operate at the University of Pretoria. Over the past 27 years, the Center for Child Law has established itself as a renowned reputation in promoting the best interest of children, both in law, policy, and practice. Our focus areas also include child protection, children who come into contact with the law, whether as victims or perpetrators. As a start of my presentation, Chairperson, if you will allow me, the focus of my presentation, the first part will be on the scale and the nature of the problem. Honorable members, the scale of violence against children in South Africa, including statutory rape, is both alarming and deeply entrenched. As we see that according to the stats by SEPS, over 53,000 children, rather sexual offenses were reported in 2022 to 2023 financial year. This is a significant proportion of these offenses involve children under the age of 18. Yet the numbers, as was already stated earlier, these numbers reflect only a fraction of the real burden, and studies have estimated that as many as 1 in 3 girls and 1 in 5 boys experience sexual abuse before they turn 18. Under the South African law, children under the age of 12 years are legally incapable of consenting to any form of sexual activity. For adolescents under the age of 12 to 15, the law prohibits sexual acts with anyone older than 16, even if the younger person appears to have consented to this. These provisions exist to protect children from exploitation, cohesion, recognizing their evolving capacity and vulnerability. However, despite this, many cases of statutory rape involve adult perpetrators, adolescent victims, highlighting the ongoing failure of prevention, detection, and reporting systems. Center for Child Law, we often receive queries from both caregivers, social workers, and even school teachers in cases where children have been sexually assaulted. And the Center for Child Law continue to see the same pattern as sexual abuse goes undetected, unreported, and unresolved, often because the system is designed to protect children do not function as they should. And again, children are often abused by people they know and trust. This could be family members. Teachers, neighbors, and this makes the disclosure a bit difficult and create immense emotional and social pressure to remain silent. And from our experience at the Center for Child Law, we see that in many communities, stigma, fear of reprisal, and lack of access to services mean that the child's cry for help is never heard. In relation to the key concerns and best practices, Chairperson, from the Centre's perspective, there are several systemic weaknesses that require urgent parliamentary attention, and these are some of the issues that were outlined earlier on from the Chairperson's presentation. So this include underreporting and non-compliance with mandatory reporting obligation. We've seen that many teachers, as well as nurses and other professionals who are legally required to report child sexual abuse, do not do so. This could be either because they are unaware of their duties or because they fear backlash from communities, parents, or even institutions. Another issue is a fragmented service delivery. Coordination between education, health, social development, and justice sector remains very weak. This leads to delay in response, duplications in interviews, and loss of evidence, all of which contribute to the secondary victimization of children. Another issue is the resources disparities. In rural areas particular, there is lack of forensic nurses, social workers, and child-friendly facilities. Some provinces have few or no functional Tutuzela centers, which are the backbone of our integrated response to sexual offenses. Another issue is a cultural and institutional silence. Cultural and institutional silence is a deep-seated stigma around sexual violence, which discourages both children and adults from reporting, and this silence sustains impunity. In relation to why mandatory reporting is failing, honorable members, Section 110 of the Children's Act clearly imposes a duty on certain professionals. This includes educators, medical practitioners, nurses, social workers, and others to report any reasonable suspicion of child abuse or neglect. This duty is mandatory and not discretionary. Again, in addition to the obligation under Section 110 of the Children's Act, Section 54 of the Sexual Offences Act also creates a statutory duty to report sexual offences. This provision, again, requires any person who has knowledge that sexual offences have been committed against a child to report such knowledge immediately to the police official. Failure to report constitutes criminal offenses, which is punishable by law. The intention of this particular section, which is Section 54, is to ensure that cases of sexual abuse do not go unreported and that the law enforcement is alerted at earliest opportunity, regardless of professional status of the person who becomes aware of the offenses. However, as the Centre's experience demonstrates, this broader obligation has not translated into effective implementation. There remains limited public awareness of Section 54, and in practice, the obligation under the Sexual Offences Act often overlaps with or is confused with the mandatory reporting duties under Section 110 of the Children's Act. This overlap contributes to uncertainty amongst professional and community members about where, when, and how to report. However, in practice, mandatory reporting is not being implemented effectively. Through Centre's engagement from some of the queries that we've received and through research and strategic litigation, so we've seen that there are several inconsistencies where there are reasons that emerges where there is lack of training, lack of knowledge and training. So we find that many professionals do not understand what constitute reasonable grounds. What constitute reasonable ground to suspect abuse or how to complete and submit the prescribed Form 22. There is also fear of retaliation or social pressure where teachers, nurses, especially in rural areas or close-knit communities where they face intimidation or community backlash where they report. There is also lack of confidence in the system. There is a prevailing perception that reporting will not lead to meaningful protection for children, that the reporting will be ignored or lost in bureaucracy. There is also administrative confusion where the reporting pathways are unclear and inconsistent between provinces. There is no uniform or digested reporting system. As a result, the law exists on paper but fails in practice, and this again now leaves children unprotected and perpetrators unaccountable. In relation to the best practices and what works, despite these challenges, there are examples of effective practices that Parliament should seek to scale and strengthen. And again, this refers to the Tutuzela centers, where they represent a strong evidence-based model of multidisciplinary child-centered care. When these centers are adequately resourced, these centers, obviously, they will ensure that medical, psychological, as well as legal services are co-located, reducing the trauma of multiple interviews and increasing the likelihood of successful prosecution. Specialized sexual offences court and child-friendly procedures, such as the use of intermediaries and private testimony rooms help to uphold children's dignity and reduce secondary victimization. And again, in schools and in clinics that have a clear internal reporting protocols and regular staff training, we will see that this will mark an improvement in reporting rates and child protection outcomes. These examples will show that when systems are coordinated, resourced, and centered on child rights, they can work. And from Center for Child Law's perspective in terms of our recommendation and what we recommend, Chairperson, we respectfully submit to the following recommendation for consideration by Parliament and relevant departments who are on the call today. So the first recommendation is on policy and legal reform, and we apologize if this has already been spoken to by previous speakers. The first is on policy and legal reform. So the first one is to strengthen compliance mechanism under Section 110. So this to develop a national digital reporting platform for Form 22 submissions, which can be accessible to all mandated professionals with automatic referral and case tracking. To require confirmation of receipt and follow-up action to ensure accountability. There should be also a harmonization between Section 54 of the Sexual Offences Act and Section 110 of the Children's Act through clear national guidelines to eliminate duplication and confusion. To also conduct public awareness campaign to ensure that all citizens and not only mandated professionals understand their duties to report child sexual offences, and also to integrate SAPS and DSD reporting systems to ensure that a report under either law automatically triggers a coordinated child protection and criminal investigation response. Again, on to protect good faith reporter. So there is also a need to have the regulation as well as the act itself to explicitly protect reporters from civil and criminal liabilities, particularly the ones who are reporting these cases in good faith. There is also a need to develop a national protocol on intersectorial response on child sexual offences. This must clearly set out the roles, referral pathways, and timelines across all departments. And again, on service delivery and coordination, there is a need to expand and properly resource Thuthuzela care centers so that every district has at least one functional and child-friendly one-step service. Also, again, to strengthen collaboration between schools, healthcare facilities, SAPS, DSD, and other relevant stakeholders. This can be done through formal memoranda of understanding and standard of operating procedures with time-bound referral and obligation, and to also establish a community-based child protection desk to make reporting more accessible and culturally appropriate. As we see that in many situations, children are often an afterthought and are left behind, particularly when it comes to issues of sexual offenses, and we see that again in the National Strategic Plan on Gender-Based Violence. Again, one of the recommendations we make is the training and capacity building. There is a need for mandatory and recurrent training for all professionals listed under Section 110. These include teachers, nurses, doctors, social workers on identifying abuse, completing report, and handling disclosure with sensitivity. There is also a need to integrate protection content into a pre-service curricula for educators, nurses, and healthcare workers. To also include a compliance with mandatory reporting as part of professional accreditation and performances review. And again, to include children, where we include them where there is a need to develop any policy, particularly pertaining to sexual violences. And also, again, to do public awareness, to teach children about the importance of what is consent and the understanding of what is consent, so that when policies and laws are developed, they are developed from their perspective and lived experiences, and they are not an afterthought. Again, with regard to another recommendation that the Center for Child Law put forth is the resources and monitoring. There is a need for ring-fence funding for child protection personnel, including forensic nurses, social workers, and trauma counselors, and for the operation of Thuthuzela care centers, and also to develop a national database of mandatory report disaggregated by provinces and profession to monitor compliances and outcomes. There is also a need where we require quarterly reports to Parliament on the implementation of mandatory reporting, obligations, and status of service delivery across the country. In conclusion, Chairperson and honorable members, statutory rape is not only a criminal offense, it is a violation of a child's constitutional right to dignity, equality, and bodily integrity. The Centre for Child Law urges Parliament to use its legislative and oversight powers to ensure that every child who suffers sexual abuse is identified, protected, and supported, that every mandated reporter understand and fulfill their obligation, or rather their duty, and every department is held accountable for its constitutional responsibility. And as we see that the failure to report child sexual abuse is not a bureaucratic oversight, but it is a breach of our collective constitutional duty to protect children from harm. We, as the Centre for Child Law, we stand ready to support Parliament and all the government departments, particularly working closely on child-related matters, as well as other stakeholders working on similar related matters. Thank you very much. Centre for Child Law thanks the Parliament and everyone for this opportunity. Thank you.
Thank you very much to the Centre for Child Law for your time this morning and your presentation, as well as your recommendations. Colleagues, we are now, and our stakeholders, we are now going to take two more presentations, which will be from Dr. Joan van Niekerk, followed by Dr. Janine Hicks, and that will take us up to 12 o'clock, whereafter I will open the floor for honourable members to give your inputs and ask any questions of clarity if there are any. So I would like to then call on Dr. Joan van Niekerk, a very well-known child rights activist. If you can take the floor, ma'am.
To give me screen sharing, please.
You got it, ma'am.
Do I have screen sharing? Thank you very much. Sorry, I'm just looking for the screen sharing link. I just want to say thank you very much to the committee for, in actual fact, allowing us to share our experiences in relation to this particular issue. It has been of great concern to myself and my work over the years, the way in which we are failing children. So just going to the start of my presentation. And is it come up, my presentation?
Yes, we can see it.
Oh, marvelous. Okay. I just want to mention that we are, in actual fact, using the wrong legal term. All rape is now statutory because it was codified in the Sexual Offences Act of 2007. And the proper term is really consensual acts of sexual penetration and sexual violation of children. I have a lot of experience in this field, as some of you might know. At the moment, I'm working as a consultant to NGOs, so I do see a lot of organizations struggling with this particular issue year after year. At the moment, I do some work for Jellybean's Child Trauma Center, for the National Office of Childline, for the Children in Distress Cindy organization, the Rosemary Collaboratory, which is an international collaboratory looking at children with disability. I'm also a member of the Executive Committee for the SA Coalition on Child Rights and an ex-member of the South African Law Reform Commission. And this is of particular concern to me, that many of the Law Reform Commission recommendations have been perhaps ignored. Certainly, that is true of the most recent report of the Law Reform Commission Advisory Committee on Children and Pornography, which the Department of Justice has sat on for the last 2 years. And I just want to mention that this is an important report by the SA Law Reform Commission that had many recommendations relating to children online, and we do know that a lot of grooming of children is happening online at the moment. So their failure to take forward and discuss these recommendations, the draft legislation, etc., and non-statutory recommendations, this is of great concern for me. As a member of this committee, I actually chaired the committee, worked very hard over a couple of years on this particular project. The report is available online on the South African Law Reform Commission website, their final report. Okay, best practices. I struggled with this because, quite frankly, I have a lot of difficulty looking at best practices in this particular field at the moment, because I really believe that our system is failing children. But having discussed this with my various colleagues, I think the presence of social workers in schools and in the Department of Basic Education has helped enormously with people getting together and discussing how best sexual offences against children can be dealt with. I also think that we are knowing that we have more and more knowledge, and it would be really great to have a knowledge repository for the child abuse field generally, not just looking at sexual offences, but all offences against children. And one of the things that we recently have become very aware of is trauma-informed care, and a lot of training on this is available at minimal cost, and a lot of it is CPD accredited, and I do appeal to people working in this field to take advantage of this. And I think another positive is the hearings of this committee. I'm a great believer in the functions of the parliamentary portfolio committees, their ability to hold departments responsible for the law that they're supposed to implement, the policy they're supposed to implement, the services they are able to provide, the services that departments are available to provide or responsible for providing. So, committee, I thank you for your work in this area, and we do hope that you will report back to all the participants in today's meeting as to, first of all, the report on the hearings, but secondly, how you believe practice is going to change, because it has to change. So the issues are, of course, we've talked about them. I've heard people talk about them this morning. Poverty. We have to accept that poverty makes children so vulnerable, girls and boys, for cooperating in illegal sexual activity, for sexual exploitation. The other issues are public officials are not responding to reports that ensure the prioritization of children's rights and their protection. And also role players are not being held accountable for not reporting. And I think we need to look at this very carefully. I don't believe in punishment. I believe in creating a context in which safe reporting is possible. We also have very unreliable crime stats due to underreporting and the SAP's reluctance to sometimes open dockets. I want to talk about this because we come across this on a daily basis in some of the contexts in which I'm working. Oh, the child will be harmed by taking this potential report forward, or this potential case forward, or it wasn't rape, it was just touching the child inappropriately. And there is no accountability here because nobody monitors really what happens at that front desk as people come in and out. And I do believe that we need to train our SAPs, especially at the front desk, that when they fail to accept a report of the sexual exploitation of children or any other exploitation of children, they are in fact putting that child in a position in which they will never be able to access justice, but usually the exploitation continues. I think that we need a central repository to enable reporting and to track progress of the report. And this is another thing. I hear it every day. SAPS does not report back to us. We have no idea what's happening to our case. There's no communication. And it's not just SAPS here. I want to mention the Department of Social Development and some NGOs as well. They do not respond to reports. They do not give any tracking of the progress of the report. Then we lack intersectoral protocols to facilitate cooperation and exchange between role players. Those protocols have been recommended for years and years. Right back to the 1983s, we have recommended firm protocols across sectors to facilitate cooperation and exchange between role players. I do believe that the Thuthuzela Care Centres provide some assistance here, but it's far too limited. And after the initial report, we actually do not have a tracking mechanism that is working. And there is a lack of intersector cooperation. Protocols would put in place the necessity for intersector cooperation. Cases fall through the cracks. There's no productive case management so that all activities are coordinated. Examples are of children being removed because there's been no discussion with the prosecutor during bail hearings. There was no opposition of bail for the alleged offender. So what happens? The offender goes home. The child, in order to keep the child safe, is removed. And so the child suffers enormous secondary victimization. Please, can't we talk together about the management of cases and what is in the child's best interest, which is supposedly paramount in our systems, but in actual practice falls by the wayside. Many children do fall through the gaps. I want to mention boys especially. There are many boys who survive through some form of sexual exploitation, especially during their pre-adolescent and teenage years. And I want to mention the research done by Cindy and Childline and the findings in that research in relation to boys. Children with disability, we know worldwide research tells us they are especially vulnerable to abuse, but little is done within systems to accommodate their disabilities. For example, children with intellectual developmental disabilities in particular. And often these children drop out of services, drop out of cases, no effort is made to follow them up. Children with disability are equally entitled to justice, but their access to justice is limited by comments such as the child has a disability, they will not be able to give evidence in court, instead of looking at alternatives that would both protect the child and give the child at least some access to justice. Having said that, I just want to mention that adults with disabilities are often not held accountable for their sexual behavior or given the opportunity to be educated on sexual rights and responsibilities. So I don't want this just to apply to children, but there are some adults with disabilities who do abuse children who are of a similar kind of intellectual age as themselves. And we have to accept that these are adults whose access to their own sexual rights and right of sexual expression but might be limited by the lack of opportunity that they have had to educational processes. So the law might be the big stick, but it doesn't necessarily fill this kind of gap. And perhaps we should look at the law as facilitating change and acceptance of responsibility rather than just the big stick. Corruption, wow. I could give you so many case examples of role player participation in negotiating damages. One of my saddest examples was that of a child in Sekukuni in the northeastern corner of Limpopo, where the mother had negotiated with the police for damages and the perpetrator, and literally her child was sold for a case of alcohol. She had a drinking problem. And when the child was abused again, because the child was no longer a virgin, the participation in the negotiation of damage resulted in even less than what a case of alcohol was considered appropriate. And this was a negotiation that took place with the mother of the child, the police, and the perpetrator. So there are many examples, but a lot of fear of exposing this in practice. And these examples are quite difficult to report, because very often those who come forward with these allegations do not have case numbers, etc. And the names of the police who negotiate these damages, because sometimes they don't wear their badges. Okay, and this is something else. Every police person should be identifiable in the same way that every social worker should be identified through the wearing of some kind of identity badge. Okay. Problems relating to mandated reporting. Why has mandatory reporting not happened? What, in your opinion, are the reasons why nurses and teachers are not reporting? Now, I have problems with this question. Why nurses and teachers? In heaven's name, in clinics and hospitals, nurses are not the head of the medical team. Where are doctors? I find that doctors are very, very slow to report, especially doctors in private practice, because there's a monetary cost to reporting, the loss of a patient family. But to go through some of the other issues, intimidation, especially in schools and community clinics. People are afraid to report because of violence in communities. A lot of my work is working with people who work in Dunoon, which is a really, I don't know how to explain that community. It's so disordered. The teachers fear repercussions if they report. Also, you know, reporting has to go through a process instead of being direct to DSD and SAPS. School and DBE protocols often inhibit the reporting, where you have a principal who wants to say, not in my school does this happen. Do teachers abuse children? And the DBE protocol in some instances is actually quite problematic. The administrative burden on educators, if you've got a class of 50 children, how much time do you have to fill out a Form 22? And so we find that there's an enormous reluctance. The Form 22 should be simplified and made as simple as possible to enable reporting. Then there's a lack of a prompt response to reports. We are continuously in the field chasing up our Form 22s with the Department of Social Development. Not all offices, but there are some offices where we get no feedback whatsoever unless there is a request for feedback that has probably been made several times. Lack of witness protection during disciplinary hearings at DBE. We had a child who was cross-examined for 12 hours in a disciplinary hearing where the perpetrator, who happened to be both an educator in her school and a close relative, there were 12 hours of cross-examination by the perpetrator's legal representative, but there was no legal representative for the child and no intermediary system put in place in disciplinary hearings. Is this a child who feels less traumatized by the fact that the disciplinary hearing was in her favor, or more traumatized by the process that failed to protect her? Please, can't we do more to protect children? Aggressive cross-examination and disciplinary hearings with little or no protection for the child re-traumatizes children over and over. There's also active discouragement of reporting and opening dockets by SAPS and FCS units. I can give numerous case examples of SAPS saying, you can't report, it has to be the child, his or her own self. Well, we know that in many instances, children, his or her own self, are not in a position to report. And the SAPS has the responsibility to follow up the reports. What is the point of doing mandatory reporting or having a mandatory reporting clause for all these professionals if SAPS says, oh no, the child has to report? Long delays in responding to and finalizing cases. Working with a situation at the moment of abuse in foster care. It was initially reported in, I think 2021. It's still not finalized. For these children involved, 6 foster children involved in this case, what is it like to wait for this period of time? Know that the offender is still in the community and the offender's family. And report back has been, unless we have sought reporting back to the children involved in this case, it simply hasn't happened. Is this fair? Does this encourage reporting? Then withdrawal of cases in which there is risk of acquittal. Can't we find some other way of dealing with these cases that are high risk of going nowhere? Prosecutors know which cases there are. Can't they consider an alternative process? Lack of consideration of alternatives to trials, conditional withdrawals. Why are we not including all medical practitioners in managing and reporting and so on? Why just nurses and educators? Government is also very tardy in implementing and updating law, as I've mentioned already through the Law Commission report. And many role players, I must say, have lost faith in the system and find that it often re-traumatizes victims and families, and they often feel held between a rock and a hard place. I have an obligation to report. If I don't report, I risk a conviction under the Sexual Offences Act, which could actually result in being put on the sexual offenders register, because you will then be an offender under the Sexual Offences Act. But also, what happens to the child? What is done in order to protect the child from re-traumatization? So I speak to a lot of role players when I'm doing training who say to me, but what's the point of reporting? It often re-traumatizes victims and nothing happens. So recommendations, we know the law. We realize that all rape is statutory, but sexual acts of sexual penetration or sexual violation against certain children is really what we should know about. What does this mean in practice? We need to educate our role players and families. The responsibility to report should apply to all professions. In fact, it does. The burden should not lie on nurses and educators. Doctors should be held accountable. If a doctor does or a nurse does a termination of pregnancy, they should know how to manage that in such a way that the contents of the uterus are collected, because this gives absolute identity to the person who has impregnated the child. the DNA testing of terminations of pregnancies and the content that is either removed or removes itself from the uterus is there. It enables us to have foolproof evidence of who the perpetrator might be, where perhaps the child's statement is not very clear. Principals of schools should be included when we hold people accountable for mandatory reporting. We come across school educators who abuse children, but their cases never get into the system because of the school's protocol. I also believe we should move away from a rights-based to society. Yes, this was very appropriate in 1994, but I believe we now have the responsibility to move to a rights and responsibilities ethos in our country. And we need to focus on alternatives to criminal trials and a focus on conviction only. Sex education in schools. I was so excited when sex education began in schools. But I'm not so excited any longer when I hear that sometimes it's just not done. Educators just say to children, read the manual, and they don't feel able to present this. These educators should all be trained, carefully selected to present this material. And it's time now, after several years, to update the content in both the learner and educator manuals. Issues as consent have already been discussed. It's so hard for children to understand the issue of consent. This should be very carefully taught in the life education of children, and life skills education should be prioritized, not seen as not as important as maths literacy and so on. We're talking about education for life here. And sexual responsibilities should be taught and emphasized, as well as sexual and reproductive rights. We also should use schools to educate on parenting rights and responsibilities. This should be taught in our grade 7 to grade 12. Here is a captive audience. Anybody providing parental rights and responsibilities education knows about the difficulties of getting parents together, of educating parents. But at school, where you have lots of parents already in high school, and sometimes even in the senior grades, you have a captive audience to talk to children about parenting rights and responsibilities. We had some lovely educational projects on this particular issue for schools.
You've got 2 minutes left on my
Oh my gosh, when a sexual offense, I'm nearly at the end. Intersectoral case conferencing. Systems must be set up to facilitate case management. Intersectoral management protocols have already been discussed. Critical. Increased protection for children in disciplinary hearings involving educators. Essential. An immediate response when reports are made to protect the school in the school, to protect the child in the school environment, and to protect the educator who might have reported this. Protection for reporters and witness protection. And my final slide, please have a look at the SA Law Reform Commission recommendations. They now need to be updated. Remember that technology advances at a far more rapid rate than the reform of law. The reform of law takes years. We see new technological advances every day. I'm being cheeky here, I'm sorry, but the Human Rights Commission should reconsider its name. We really need a Human Rights and Responsibilities Commission at this point in our country, in which we restate responsibilities. Every human right has a responsibility attached to it. How do we implement the responsibilities that are given to us along with our human rights? I love our human rights context. It's not enough. The National Sexual Offences Committee must open its membership to civil society representatives and not just high-level officials who are out of touch with practices on the ground. And that is my presentation. I will send it to the committee, and thank you for this opportunity.
Thank you very much, Dr. van Niekerk, and thank you very much for the work that you continue to do for our vulnerable children. I think we agree that we are collectively failing our children. We also share your concerns with regards to the challenges or the fact that children with disabilities are even more vulnerable and that we need to put more focus on our children with disabilities. I do think the motion that was passed in the National Assembly referred to teachers and nurses, but we do recognize that the Children's Act mandates everyone to be responsible for mandatory reporting. It speaks to teachers, doctors, immigration officials, correctional services officials, social workers, and others. So really, mandatory reporting is everyone's responsibility. You opened up by asking about the report. Indeed, we are now in phase 1. So once we've compiled the initial report, we will be making it available to all our stakeholders for your further inputs and comments. So that will be made available to you. Thank you, Doc. Just stay with us because we'll take one more presentation, which is Dr. Janine Hicks. And then, honourable members, please do get yourselves ready to be coming onto the platform to ask your questions and to make your inputs, please. Over to you, Dr. Hicks.
Thank you. Greetings, colleagues. Greetings, Honourable van der Merwe and Portfolio Committee members and colleagues. Thank you so much for this opportunity to present before this committee today. I am going to turn my camera off just so we can focus on the presentation and to ensure that we don't go glitchy. I appear before you today. Well, first of all, these are the aspects that I will be covering in this presentation. The partners and stakeholders involved in putting this submission together, our primary findings in relation to systemic failures and gaps, and our recommendations. So I speak today, the submission that has been shared with this portfolio committee is on the back of a concept note developed by a working group that I'm part of. And there you will see the different stakeholders represented in that working group. We're a small team in KwaZulu-Natal who has been concerned at this issue of child sexual violence, child and teenage pregnancy, and the gaps and the fragmentation in the policy response and accountability that ensues. So we're delighted to have some of our Chapter 9 stakeholders in the province from the Human Rights Commission, the Gender Commission, and our Commissioner Bacchus, who joins us as well. And then our stakeholders from soccer in our province, Advocate Omashni Naidu, who's the head of the Sexual Offences and Community Affairs unit of the National Prosecution Authority. You've met already my colleague from the School of Education this morning, Dr. Wiebersek, and I'm joined online by further colleagues from the School of Law, Professors Anne Strode and Dr. Suhaifa Bamji, who are experts in this field and who've conducted empirical field-based research with social workers and other community stakeholders in the field and published on this. So thank you very much and full recognition to my colleagues. I would then move to what some of our primary findings and insights are, and I realize I should open this into a full slide so that you can see better. Great. You will have heard already this morning, and my apologies, I was only able to join an hour ago, our concerns are obviously that children are disproportionately affected by sexual violence when compared to other stakeholders within the community. Something that we wanted to point out, and I'm sure that Commissioner Pilila did make this point, when we're talking about child sexual violence, we must acknowledge the nuances of race and gender and class, and how these are disproportionately prevalent in incidents of child sexual violence, that we are predominantly talking about poor young Black children in instances of child pregnancy at a disproportionate level. Of course, child sexual violence is a phenomenon and a scourge across all race, class and genders, but we must note the disproportionate prevalence of the incidences of child sexual violence within this category, and our response, our policy response and interventions should be nuanced to address those particular vulnerabilities. When we look at not only the high rates of sexual violence, but also the teenage pregnancy, our finding is that this is flowing from systemic failures that we will be speaking to in the submission, and my colleagues' published literature in this regard speaks to this in greater detail. We also wish to bring to this committee's attention, and there'll be a particular input that we make in this regard, that we need to distinguish child sexual violence sexual violence against children distinct from pregnancies resulting from consensual underage sex. We cannot have a blanket reporting and policy response to these different categories of pregnancy if we are to address them based on the needs that our evidence from the field indicates, if we are to address this phenomenon. And in this regard, our recommendations are that the full force of the criminal justice system should be unleashed in instances of child sexual violence. Yet more nuanced responses are required when we're dealing with consensual underage sex. Moving on. Right. As a starting point, pointing to systemic failures, we've been concerned, and I'm sure Commissioner Ntuli spoke to this, at the language that we use when we're dealing with this set of issues. We talk about teenage pregnancy, and our concern here is that this term masks, first of all, age differential when the pregnant young girls are in fact children, they're not teenagers, they're as old as 9 or 10 years old. Our concern equally, though, is that the incidence of sexual violence becomes masked when we term this teenage pregnancy, because as a result, what we see when we talk about teenage pregnancy is that we tend to get this health and education response kicking in. We've got to deal obviously with our counseling of the children who are affected. As a result, we see health stakeholders kick in to deal with the actual pregnancy and the health of the child. And obviously, there's an education response in relation to concerns pertaining to the child's ongoing education. And yet there is not as diligently or vigorously a referral to the criminal investigation and prosecution of the offender, the perpetrator who has impregnated that child or that teenager. A second systemic concern of ours is in relation to data, and Dr. van Niekerk did speak to this, but for instance, we see clustering of incidences when we try to extract data, that we see this all gets clustered within the age group of 12 to 18-year-olds, that we don't see the differential and nuanced reporting that indicates different age groups and categories, which would indicate the more evidence-based understanding of how that of the origins of that and an appropriate response. But equally, as Dr. van Niekerk pointed out, not only do we have underreporting, but where we have lack of cohesion from those frontline, those desk officers, whether it's in a health context or an education context, those frontline officials' understanding of sexual assault and rape and what constitutes sexual violence, therefore impacting then on how and whether they report those incidents, then distorts the statistics that we have available to us on the number of cases that are coming through. We also find an unacceptable difference within the different departments. So the Department of Social Development will have a completely different set of statistics around incidents of child sexual violence compared to Department of Health and the Department of Education. And of course, as has been referenced already, our concern is at the inadequate communication and referral of cases between departments, that these are treated in isolation and there's inadequate communication and referral for follow-up and monitoring and overall coherent response to those instances of child sexual violence. We equally concerned, our focus in a fragmented way is on the reporting, but we're concerned about what happens downstream, the inadequate monitoring and follow-up on cases. So, for instance, if a child presents to a clinic for a termination of pregnancy, is there a follow-up by, for instance, the Department of Social Development? Are they alerted that there is a child at risk who should be monitored? Are there home visits for that child? What happens in instances where that child may have been impregnated by a family member? What happens to the child when she returns home? And what levels of vulnerability are there for further abuse? So that ongoing reporting and follow-up is essential. Sorry, I'll jump to slides. Next one. So when we coming to focus on policy gaps and implementation shortcomings that we'd like to bring to the portfolio committee's attention, our concern, and this is what led this working group to begin working on this concept note, our concern is the fragmentation and lack of coherence. I'm getting an unstable internet connection, and I hope colleagues are able to hear me. We're seeing a fragmentation and a lack of coherence in the directives, in the protocols that are issued to the different departments in terms of the Sexual Offences Act, and a need for stronger coherence and detailed and integrated directives to these different departments within this ecosystem. We're concerned at an overburden that appears to be placed on educators, primarily because they are the ones who obviously get to encounter a child, but only when that child becomes pregnant. But that overburden placed on educators to tackle and respond to instances of child sexual violence, as opposed to other departments and community stakeholders who share responsibilities to ensure that where children are in harm or at risk, these cases are reported and monitored, apart from the intervention and prevention measures that are required. We also stand behind and express our concern at the need for an urgent response to address the increase in number of cases of child sexual assault caused by educators. We're equally concerned across our different policy and legislative framework around and the need for policy clarity on issues such as age of consent, age of marriage, parental consent being invoked in some instances for underage marriage. We need policy clarity in that regard on an absolute coherence in terms of the age of 16 being clearly established as an age of consent. We also want to echo the points raised by Dr. van Niekerk around issues of safe reporting of fear and intimidation. Evidence from the field indicates vulnerability of individual officials, whether that's in education or a health or even a police official, where they themselves are at risk for violent responses, where they refer and report cases involving people, for instance, of stature within a community or within a school, and a lack of the remedial measures to mitigate that and ensure safe reporting. apart from fault lines in our state response, we must also flag fault lines in our community, our family, and our religious and our cultural institutions that sometimes serve as barriers to the reporting. Dr. van Niekerk spoke to the concern about negotiation of damages, but in instances where we see distorted practices or customs dressed up as culture or religion, we need our policy response to child sexual violence to address and respond to those social elements. Flag then a cluster of issues around this category of teenage pregnancy, that of underage consensual sex, where that sex is rendered and that sexual conduct is rendered unlawful because of the age of the stakeholders. And this is where both parties, both children are in fact children and below the age of consent. We wish to bring to the Portfolio Committee's attention, obviously guided by the teddy bear judgment, the fact that a nuanced response is required, as that judgment clearly established for us child sexual and reproductive health rights and the need to not criminalize normative sexual exploration between and among minors, and the need to move from a criminal response to a social development response. We are concerned if we have overbroad reporting obligations in relation to referring underage sexual exploration and resulting pregnancies. The impact of this could result in educators being cast in this role of policing then consensual sexual relationships, which impacts then on trust relationships between children and teachers, that they will be loath to bring forward and alert a teacher to instances because they fear then that a criminal justice response will ensue. So in this regard then, where we have mandatory reporting of all pregnancies, that there are, and our research indicates that there are unintended harmful consequences where those instances are between children below the age of 16 and within that 2-year relational age group. This may deter then the young girl from coming into prenatal care, worrying about, for instance, that triggering a criminal justice response, and the impact that that has then, for instance, on the relationship of the father of that child to the young child. We are pleased to see and note the responses, the suggestions Dr. van Niekerk has put forward about in relation to alternative solutions that might exist in this instance for social workers, for instance, that of counseling and a social development response to that underage consensual sex. We're concerned about the boy child as well, and note an alarming increase in the prevalence of young male sex offenders, so young boys committing acts of sexual violence against young girls. We also want to flag for the committee that even though we are talking about consensual underage sexual relationships, in many of those instances, in those consensual relationships, our evidence shows that many young girls are reporting that their sexual debut was in fact coerced, indicating the need for much more rigorous education and awareness around issues of consent, for instance, and gender-based violence in our child sex education project. But above all, beyond purely a criminal response, we need to focus as well on social and educational interventions to address those gendered norms and behaviors that lead to these coerced instances. So to close then, colleagues, in my final 5 minutes, we've got 5 recommendations of areas of work that we would like to put before this portfolio committee. So these recommendations arise from the working group in terms of work. You're at your stage 1 of the process, Honourable Chair, recommendations and suggestions we'd like to make for this committee to focus on. The starting point is the policy and the legislative framework. We believe that there's a dire need for the policy and legislative framework for those stakeholders across the sector, from basic education, health, justice and constitutional development, and the related stakeholders of SAPS and the National Prosecution Authority. We think it would be most helpful if this portfolio committee calls on those stakeholders to report on their policy and legislative frameworks that have a bearing on child sexual violence and child and teenage pregnancy. And for your researchers and stakeholders within your committee to then analyze that policy and legislative framework to identify where those gaps are, where those contradictions are, for instance, in ages of consent, identify shortcomings and develop recommendations on harmonizing then policy and legislative frameworks. The second set of work, colleagues and honourable members, that we believe is needed is this issue pertaining to protocols. And Dr. van Niekerk has spoken there about the need of intersectoral management protocols. I note on the chat, Ms. Pat Mutley, our former regional head of justice in KwaZulu-Natal, has brought to our attention the fact that there should be provincial intersectoral committees in place who should be doing this monitoring and evaluation work. So our request to this portfolio committee, in your engagement with those department stakeholders, and this is what our policy intervention group was seeking to do in our province, is to ask and call on those departmental stakeholders to explain to your committee what their protocols and guidelines and follow-up and monitoring mechanisms are. Again, so that your committee can then identify where are those gaps and develop recommendations for synergy and cooperation between stakeholders using the wealth of information that's available from the Law Reform Commission and our existing intersectoral committee framework that should be in place. The third area for intervention by this portfolio committee has been referred to already, is the need for training and resource allocation. We request and recommend that this portfolio committee, in its engagement with those stakeholders, request for information on the extent of existing training interventions. What training is being offered to educators? What training is being done to our health clinic, our nurses, our doctors? What training is provided to our judicial stakeholders, not just our prosecutors, but our judges as well, to our frontline SAPS officials and police officers, to our social workers, to traditional health practitioners, to traditional leadership? What training is provided by those stakeholders in this ecosystem on their roles and responsibilities in relation to reporting and response, on addressing and mitigating those gendered biases and stereotypes that might lead them to misunderstand and misconstrue sexual violence? And then for the portfolio committee to develop recommendations on appropriate training interventions and resources. Final slide and last two recommendations, and again, this has been referred to already. Our concern is this lack of accountability. We would request the portfolio committee to pay attention to accountability mechanisms for stakeholders in this ecosystem. We know that a mandatory and a legal obligation is created by our Sexual Offences Act. What accountability mechanisms are in place for those state stakeholders, whether that's a doctor, a clinic staff member, an educator, a school principal, who fail to respond to and who fail to report instances of child sexual violence. And we request and recommend that this committee develop recommendations on appropriate responses. We have to ensure that those who are enabling and perpetuating child sexual violence and those who are derelict in their responsibilities to children are being held accountable for their actions. And finally, Honourable Chairperson and committee members, as has been referred to already, there is a need for greater synergy and collaboration and partnerships in community awareness raising. We would call upon and ask this committee to guide us in developing recommendations on partnerships between state stakeholders and social partners on appropriate interventions to raise awareness within communities diverse communities on child sexual violence. We are required by protocols such as our Maputo Protocol, for instance, to enact measures that address societal and cultural norms that perpetuate gender-based violence. What measures are we putting in place to address those societal norms and cultural and religious practices that may be causing harm or that permit that violence? What transformative interventions are required? We would appreciate this committee's applying its mind to recommendations on such partnerships and awareness intervention to drive these kinds of measures. Thank you very much, Chairperson and colleagues. I've shared this presentation and our full submission as well for you. Thank you.
Thank you so much, Dr. Hicks. And we also agree with you that in our initial investigation in Johannesburg and East London, we were also quite concerned that none of the statistics presented to us by the Department of Basic Education, Social Development, Health, Justice, and Police spoke to one another. So we couldn't even get a clear indication of the crisis or the extent of the crisis that we are facing. But thank you so much for the work that you've presented to us this morning. Colleagues, now is your opportunity to raise your hands. I'll start taking hands for inputs, comments, or any questions for clarity. We heard about the need for ring-fenced funding for social workers and child protection services. We heard that more laws won't fix this crisis, but that we need to implement current laws while identifying shortcomings. We heard about the need for more training for our SAPS officials, our teachers, our social workers, our health workers, and judicial stakeholders. We heard about the need for a central depository where cases can be filed and followed up. We heard that we need to fix the silo approach that prevails between government departments and various stakeholders, and a need for more synergy in this fight, and that we need accountability for those who fail, who collectively fail our children, those who are derelict in their duty. So, honourable members, I see your hands. We will take Dr. Letlape, followed by the chairperson of the Portfolio Committee on Health, followed by Honourable Chauke Adonis, followed by Dr. Leroux, followed by Honourable Chirwa Mpungose, and followed by Honourable Kanhile, followed by Honourable Shabango. Doc Letlape, it's your opportunity.
Thank you, Chair. I'll just provide a picture for proof of life, and for bandwidth issues, I will stop the video.
We can see your live.
My question, it's we probably need to have a thorough reform of the processes around this issue, because there's a lot that is wrong. So I'm glad that we started on mandatory reporting, but the question has been asked, and then what? And with respect to that, my question is, should the heads of the institutions not be the ones that are held responsible for the mandatory reporting, the principals, the CEOs, etc.? Because there has to be an enabling environment for reporting. Sufficient staff, sufficient forms, explanations, who collects the forms, clarity about if you are a teacher and you've got the form, are you the one that goes to the police station? The issue about should it be reported elsewhere? What is the authority lines? So all those issues, so that we want to get away from a blame culture. We can't bring a blame culture to reporting as well. It has to be something that is supported and enabled. Now, a major issue, Chair, that has come through is this issue of dehumanizing people that are poor, bringing disrepute to them and blaming things on poverty. From what I've heard on the roadshow, what we're dealing with here is basically a sex trade masquerading as culture and using poverty as a scapegoat. So we need to be able to interrogate that. But going back, it's about whether, as we made these laws, Was there thorough engagement with impacted societies whose cultural norms would basically be put on trial? And how do we go back to that issue? And second last, we got to deal with the consent nightmare and dilemma and be clear so that society is not confused. We have a 12-year-old that can give consent to termination of pregnancy. But in the same legal framework, the same 12-year-old up to 16-year-old is not able to give consent for sex in terms of the law. We need to create something that is understandable to ordinary people, that does not create a nightmare. And we need to review how these things become synchronized and how we explain them to ourselves and to others. Lastly, I'd concur with the second last speaker about the fact that we need to change our legal framework from that of rights only and no responsibilities, where perpetrators see no justice. And those perpetrators are the ones that seem to have the law on their side, and victims get no justice. So we need to bring all these issues into the equation. So for me, it's an opportunity for a complete overhaul of the interrelated issues, and we can't deal with it piecemeal, just create more laws that can be complied with. And as we create whatever we create, we need to ensure that it is funded to succeed. Thank you, Chair.
Thank you, Doc.
Thank you, Doc.
Somebody's got the, okay, they said, I forgot to say, colleagues, we are going to adopt the same practice that we had when we were on the road in Johannesburg and East London. Each member will get 3 minutes. So over to you, Chairperson of the Portfolio Committee of Health. But for you, it doesn't apply because you're my fellow chairperson. So over to you, ma'am.
Thank you very much, Chairperson. I appreciate all the presentations. I am showing proof of life now, but I will take it off because of connectivity, just for you and the meeting to see me. Thank you, Chair. In appreciating all the presentations, I will start by a general comment to say this non-reporting or less reporting, to me, I take it as if it is as a result of the stigma associated with statutory rape, ignorance, and also the conditions. I wanted to highlight that, Chair, because out of the presentations, you get that. I also appreciate that we were afforded an opportunity to get the report of our stakeholder engagement from the two provinces. That also assisted. And there are commonalities between what was presented to us by those that we engaged and what is presented here today. To the presenters there, I just wanted to check if there is any coordination in their operations amongst them, the Chapter 9s and also the social partners, because for us to see the impact, this work needs to be coordinated. Also, trying to find out if there are any recommendations that they have made regarding a gap in legislation in trying to protect the underage children, including minors. Chair, I am also interested in their experience on the lessons that they have learned around young girls that were abused when they were still underage or minors. I think guardians or parents have failed, teachers included, have failed those minors. But what makes it difficult for those when they are adults to report those cases? I follow up what was in the social media. Girls reporting statutory rape, reporting sexual abuse, but even now they are not reporting those cases to SAPS. Also, Chair, these social partners in Chapter 9 must share with us where they identify gaps in legislation. They must also point out to certain clauses or acts or policies that they think we can review or repeal in order for these legislation to be responsive to the crisis that they have mentioned. I agree with Dr. Van Nierkerk when she says the health practitioners and teachers are failing these young ones. But I also want to recommend this mandatory reporting even to parents and guardians, because some parents do not report. They choose compensation over child protection and child safety. I also suggest to these groups and Chapter 9s to fight the stigma. I think the stigma is on top of this non-reporting. It contributes more to the non-reporting of this statutory rape and other sexual offenses. Adding to the issue of life skills, life orientation does include life skills, but I think we must press on education to put emphasis on sex education, because it is already there as a learning area, but education must emphasize on sex education. I wanted to comment around that, Chair. Thank you very much for affording me the opportunity. Thank you.
Thank you very much to you, the Chairperson of Health, and thank you for the support you've given us throughout this process. I'm going to hand over to the whip of our Portfolio Committee, Honourable Chalke Adonis. Your 3 minutes.
Thank you very much, Chairperson. I'm going to switch my camera on and off, just so that you can see that I'm not an AI.
We can see you,
I am visible. Thank you very much and greetings. I'm going to, through you, Chairperson, switch off my camera.
That's fine, Whip.
Thank you very much, Chairperson, and greetings to the honourable members and also to the stakeholders who have joined us, and just appreciating the presentations that have been given before us or presented before us. I think what is most important and what I'm taking away, Chairperson, from all the stakeholder engagements that we have had through their presentations is that they are not only presenting the identified systematic barriers and challenges that they have identified as civil society organizations, entities, and institutions, but they are giving us resolutions. They are giving us recommendations that seek to strengthen the work that we are given at a point of a portfolio committee, at a legislative point of view, but also providing solutions as to how we can implement and reinvent the work that is then done in the ground in provinces and in local government. Chair, I would like to just also appreciate the presentation or the sentiments of Dr. Van Nierkerk that seeks to say that perhaps the institution of the Human Rights Commission needs to be changed to the Human Rights and Responsibility. And I think that is a very bold statement that the doctor made there, to say, how do we ensure that with these human rights, there is an attachment and a level of responsibility that is then assigned to the human rights that we then have. Chair, my question, give me a second. My question, Chair, I think to the Human Rights Commission would be, and also to the CGE, it is, what is the collaboration that is then taking place in order for us to see how the data exchange is taking place. But not only that, how do we ensure that there are no parallel processes that are then undertaken by these entities and institutions. And I think one of the biggest problems that we have had in the past is where there is a disunity or a disjuncture between your CGE and Human Rights Commission. And I think in this instance, where we're speaking about statutory rape, perhaps what is important for us to be highlighted on, it's how they are collaborating, how they are then monitoring and evaluating, but also where is the level of accountability amongst themselves, especially those who are Chapter 9 institutions. My other comment, Chair, would be, and I think we've already picked up this and we cannot echo it enough, is the lack of interdepartmental collaborations and partnership and sharing of data and information. And I think that is part of the responsibility at a legislative point, that we need to ensure that there is interdepartmental collaboration that takes place in order for us to really combat statutory rape. Lastly, Chairperson, from a point of the legislative point, I think I have identified that there's a disjuncture, or for lack of a better word, the legislations, our laws are not speaking to one another. And therefore, it means as portfolio committees, we need to reevaluate and review the legislations that have been passed in the past. And look at the relevance, number one. Number two, look at whether they do not contradict one another. And then lastly, to ensure that they are supporting each other at a legislative point of view, because I think that is one of the biggest concerns that have been raised by our stakeholders. But overall, there is an appreciation where we are seeing that civil society is on the ground. They are working. They are providing us with recommendations and solutions. And therefore, it is our responsibility to ensure that we are driving them forward. But at a legislative point of view, Chairperson, I re-emphasize that we must look at the legislations, whether they are still fit for purpose. How do we then re-evaluate, and maybe the possibility of amendments being made? And this would require joint portfolio committees to then sit, and departments to then sit and re-evaluate the legislations and the purpose, whether they are still fit for purpose and whether they do not contradict one another in the long run. Thank you very much, Chairperson, for the opportunity, and thank you to all our presenters.
Thank you very much to you, Honourable Webb. I'm going to hand over to Dr. Leroux. Dr. Leroux is a doctor by training and the former chairperson of the Rural Doctors Association of South Africa. So we value your inputs, Doc. Over to you.
Thank you very much, Chair, and thank you very much to the presenters. Yeah, I'm here as a member of the Health Portfolio Committee, and I I wanted to just appreciate all the presenters. I think it is a very complex and difficult issue, and I think it's an issue that has a lot of nuance to it, particularly in the context of the most severe forms of rape, which, very small children being raped versus consensual sexual relationships between two 15-year-olds, for example, which somehow fall under the same category. And so I appreciate the nuance that has been brought in by some of the presenters. I think for me, there are a few things. My context is working in the rural health sector, and when you have a 12 or 13 or 14-year-old girl coming in pregnant with a baby, that is as a doctor in a very busy hospital, that is a complex situation to deal with, and it is a situation that is in some ways beyond the scope of the doctor. And I think that there has to be a really strong and good protocol to how do we deal with these cases. And I think for me, one of the things that I would really like to urge us to do is to think about how we can work with the provinces to see how those processes are put in place. And so I do appreciate the comments about processes, about better statistics, that our statistics reflect the practical issues that are there, that we shouldn't be lumping 12 to 18 years old pregnancies together in one group. We should be differentiating maybe 12 and under, 13, 14, 15, and 16 and above. Those in terms of the way we gather statistics as well. I think we also just really have to have a very clear processes that are in place, that what we would do in the hospital where I worked is we would refer such a child to a social worker, and the social worker would then do an investigation and then sometimes report that to the police, and work with the family. And I think that there needs to be a very clear, strict protocol about how we approach these things if there's been a big gap between the father and the child. And I think the other thing to recognize is that in some ways, because sexual violence or rape is often very difficult to bring to prosecution, with the case where we have children or young women or under teenagers coming with pregnancies where there's clearly there's a clear concern about the difference in age between the father and the mother. I think that we have got DNA evidence available if that baby is born, and I think, and even if there's a termination, which allows for us to have a much easier path to prosecution than in the case where somebody presents 3 or 4 days after a rape case, where the DNA evidence is much harder to collect. So I think that those are all things worth considering and talking about. And I do feel like in these cases, particularly in the education and in the health sector, I think there needs to be a real clear, and I want to echo some of the comments of my honourable colleagues around that we have very clear delineation around the issues that are there, and that the legislation is very clear, and that the protocols are very clear around that. I think that I just had some, in terms of that, to the presenters, I had 2 questions. I think the one question, I'm not sure if this is any of the presenters are able to answer this, but it would be interesting for me to see how often we do, for example, a buccal swab for DNA of a child that's born to a young mother where there is allegations against an older man. Do we use that often? How often is that effective? And have we had any prosecutions around that? I also wanted to just ask more broadly around, and I don't, from the researchers perhaps, we have an epidemic of pornography in this country. It's accessible on phones. It's accessible to young children. And my question is there any evidence that is having impact on sexual behavior and perhaps on some of the abuse that we see? Those are my questions and my comments. Thank you very much, Chair.
Thank you very much, Dr. Leroux. It's now your opportunity, Honourable Chirwa, your 3 minutes.
Ngiyabonga Sihlalo, proof of life. May I continue without the video?
Yes, ma'am. Please, Mhlonishwa, continue. Thank you.
Ngiyabonga Sihlalo. This is what we have to contribute namhlanje as the community fighters ngegama ngonaledi Chirampungose. And Sihlalo bengicela bandla indaba ye termination of pregnancies. Sibheke ngekindlela as to what we have been over the past few days, few weeks in our engagements as the portfolio committees, right? Because we must not forget that termination of pregnancies is actually linked to it being a health right, and there's a deep complexity on the premise of sexual violence and how it manifests, right? There are children who are raped by the very same parents that we are asking to come in and consent to their pregnancies. And second to that, termination of pregnancy is the only deterrent to reporting that a child came into the clinic and is pregnant, whether they want to terminate or not. So please, let's not conflate the 2 issues. They are very important rights, especially in the scope of preserving the future economic liberties of these young girls who present with pregnancies, some who come from dysfunctional homes and domestic violence homes, who experience these violences in the homes where they come from. And then second to that, Sihlalo, bengicela ukuthi lama committees esihleli sonke la in this portfolio committee, that we decide and make a resolution which sends the national task team, that we establish a coordination system, right? And then Leo task team, it must report to Parliament every term of Parliament, and must be made up of relevant government officials in the provinces, grassroots organizations, the Department of Justice, SAPS, NPA, Nama MP aba-volunterayo, they will be forming part to oversee and participate in this process, so that we don't leave it to the hands of others when it is us as Parliament that has undertaken this process, that we take full responsibility as well in our capacity as members of Parliament, with the constitutional obligation to do holding executive accountable and doing our oversight function. I think the establishment of the national task team that focuses on this particular issue that is ongoing that doesn't come to an end and end in just a report being tabled in Parliament be established and overseen by Parliament. And then number 3, before Nketa, our teacher and our nurse ever praised us on contributing factors behind in non-reporting. And they include safety, coercion from families and threats and all of that. And we must find a way that we are able to respond to that with tangible ways to ensure that we empower them with a system that is able to protect them in the process. It is much more easier to report it, to call in SAPS to say there's a gun wound that just entered the hospital. And it doesn't require the complexities that we see imminent in reporting a child being raped or a child presenting with a pregnancy. So those small things that we need to address as well, what in the guidelines that have been provided, if there's any, that allow for this particular topic or aspect to be much more complex than other crimes that present in public institutions that are easily reportable as opposed to this one thing. And then lastly, Slalo, mina ngicela ukuthi as members of Parliament, as the different portfolio committees, in our portfolio committees, that we add school visits to these schools that have high reportages of child pregnancies, so that ourselves we go and do this work to start and get the ball rolling. Because we know these clinics, the data is there, and it just requires people with the political will and the enough sense of urgency to address this matter, to go out and hit the ground running and stop pointing fingers. Your contribution as the EFF, as Tate Lomsebenzi as the Parliament ourselves, and do it ourselves, and then everybody else will follow the lead of Parliament. I thank you, Slalo.
Siyabonga kakhulu Mhlonishwa Chirwa. Thank you very much for those inputs and comments. I also do think we need to, in our recommendations, look at the issue of this, of mandatory reporting and how we make it easier for our various role players, whether it could be through an online system where these cases can be lodged and tracked. And I also do think at one point Parliament envisaged having a standalone portfolio committee to oversight the issues of the National Strategic Plan on gender-based violence and femicide, and including issues around crimes against our children. And I wonder how far we would have come in terms of tackling some of these issues if we had a standalone committee oversighting some of this work. But those will be some of our recommendations, hopefully, as we go forward. Honourable Kanile, you are up next.
Thank you very much, Chairperson. Chairperson, I have been largely covered by the colleagues that have spoken before me. I'd like to take the opportunity and greet the fellow honourable members as well as stakeholders that are with us today. Chair, can you please allow me to switch off my video? I have a problem with the bandwidth.
Yes, no problem.
Okay, thank you so much. Chair, like I have indicated previously that I have been largely covered by my colleagues. However, there's an issue that I wish to reiterate, an issue that came out strongly when we were in Gauteng and the Eastern Cape, the issue of SAPS. SAPS is not cooperative, and not only on issues of statutory rape, even on cases of on gender-based violence. At the moment, I have 2 cases that I'm working on where SAPS is turning people away. They don't want to open cases. It is when you intervene that they then act. And I am worried that for community members that do not know that they can even reach out to us, they will never be able to see justice. I think when we write our recommendations, this should be something that we strongly raise as members of Parliament, that we do have laws that indicate that SAPS can open and investigate cases, but at the moment, SAPS seems to be turning victims away. Chair, I think another emphasis should be on the issue of social workers, maybe an emphasis on social development as well, so that they can look at their budget going forward, because there is a need to have social workers on the ground, to have social workers linked to schools. And at the moment, with the number of social workers we are having, it looks like there is a very serious gap. This is another issue that we are going to have to look at. I think mine are basically comments. I was largely covered in the presentations. They were very, very detailed. And Chairperson, another issue, I think this is the last issue. the issue of forensic laboratory, the backlog on the DNAs, I think this is one issue that we seriously need to look at, because I remember there was a presentation, if I'm not mistaken, by CGE, where they indicated that they went to Mpumalanga for an oversight, and sometimes they were advised that SAPs in Mpumalanga, they end up throwing away their samples because they are not collected or they are not getting results. And it's an issue that we have been raising a number of times, that this backlog needs to be cleared. I think it is about time that we put more pressure and maybe an oversight be conducted so that we can go and find out what is the cause of this backlog so that it can be addressed, and each and every person that have reported their cases, they see justice. Because at the same time, I feel that it is unfair when there's a case that is being raised on social media, you see that case be overtaking all other people that have been waiting for DNA results. Their results will come out faster because now social media is putting pressure on SAPS or on the government. We should not only react when there's an issue that we are seeing on social media. All cases, they must be treated with the importance they deserve. Thank you, Chair.
Thank you very much, Honourable Kanile. Honourable Shabango. Thereafter, it will be Honourable Mare from the Portfolio Committee of Social Development. Over to you.
Thank you, Chairperson. I'm alive.
We can see you alive, Ma.
Thank you. Chairperson, greetings to you and all the members in the platform. I must say that I'm widely covered by my colleagues that have spoken on this issue, but before I step down, I must say that this is a very critical conversation that we're engaged in. And one is encouraged by see so many stakeholders that are coming together to deliberate on this crisis that we're faced with. We also want to appreciate their effort to fight this scourge of statutory rape. However, Chairperson, from all the presenters, the challenges that were mentioned, the mandatory reporting stood out as the biggest challenge that they are experiencing. Well, I must say, Chairperson, that leads to the victim falling into those cracks. But nevertheless, all the presenters, they sound like they are expert in this and they know what they are supposed to do. We believe that if all the hands can be put on deck, there will be results. It's a matter of addressing all the challenges that were mentioned here. I don't want to repeat on those challenges. The presenters themselves, they mentioned the challenges, and all of them, they've got good recommendations, of which if those recommendations are put into, they are implemented, we will really see the outcomes, which are better than what we are experiencing at the moment. Having said that, Chairperson, like I said, that I'm really well overcovered by the other speakers that spoke before me. I would like to appreciate this time and appreciate all the presenters that gave us their report. Thank you, Chairperson.
Thank you so much, Mklonishwa. Agbare Mare, dis nou jou geleentheid.
Good day, Chairperson, and thank you for all the presenters and all the honourable members. I've listened to all the inputs, Chairperson, and I want to say, it's always nice to have things on paper, but the implementation of these things are always difficult, because I'm talking about experience. I took a 10-year-old child that was raped. I took them to the doctor. The doctor said, no, I need to go to the hospital. When I got to the hospital, the sister that was sitting in front of the desk, I said, ma'am, can I see you quickly? This is a private matter. No. She's shouting at me. You can speak in front of everyone. Our people need to be sensitive when it comes to issues like this. And then the police took their own time to come and investigate, not just investigate, to take the child to this place in Bloemfontein at National Hospital. Tupong, the people that is working with these cases, it is like they are doing people a favor. It is like, you know what, I'm just doing my work and it's over and done with. People that is going through trauma already don't need a person that is going to shout at them. So on paper, it is very good. But in practice, it is not happening. SAPS keep on saying they have a special center where victims can go. But the majority of the times, people are standing in front of the desk to explain themselves. No privacy, as like you've been interrogated with in front of everyone. The same with the hospital. Nurses are not sensitive enough to deal with these cases, Chairperson. So it is nice to talk about these things, but the implementation of these things, it is the biggest problem, because I'm dealing with these things. Even the courts. I went to court with a girl, where the stepfather was raping her, and the court just threw the case out, because the police didn't do their work, So somehow, somewhere, we are failing the victims. Somehow, we are not doing enough. And if we don't go and say, look, I'm a member of parliament, these people are not being assisted. Now imagine if you are not there, what stress are these children and these parents going through, because no one is prepared to help them, no one is prepared to assist in anything. So when the child becomes pregnant, then the mother wants to say, like this girl, the stepfather was raping her, the mother said, no, it's not like that, the child got pregnant, now the mother's fighting the child, so where must the child go, Chairperson? We need to have facilities to see how we can assist these things, because some of these facilities are not enough. The Tutusela facilities, they are doing well, but there's not enough of them, Chairperson. We need to have in every province, every region, to make sure that municipalities are having these centers so that we can see that these things, people are being assisted, Chair, because this is a very sensitive thing and it's a very personal thing. So that is my contribution, Chairperson, and I want to thank you so much. Thank you.
Thank you very much, Honourable Mare, and thank you very much for representing the Portfolio Committee of Social Development this morning. Colleagues, please lower your hands. I'm going to call our stakeholders in the order that they presented to us this morning to see if they've got any responses that they would like to give. I'm going to give them 3 minutes each. So we will start with the Commission for Gender Equality.
Thank you, Chairperson and honourable members. From our side as the CGE, we note what has been raised here. I have just got a small correction. The laboratory specimens that are being destroyed are actually being destroyed in KwaZulu-Natal. And I also just want to add that when we went there last year, because we did a complete provincial criminal social justice cluster accountability hearings, we found that on average in a quarter, all the relevant structures that we have mentioned here, NPAs, SAPs, and all of those, have 14 meetings. 14 meetings, all of them as a collective or amongst them. And it was worrying that none of them could then answer what the problems are. If in 90 days you have 14 meetings, every week there is a meeting with one or two of your partners in the cluster, but nothing is moving. To a point, for example, where specimens are being destroyed and you hold meetings with these people every 5 days. And there isn't communication to say, at this rate, I'm going to destroy your specimen. So it's more convoluted than this. And I'm glad when we say, let's go back and look at what else needs to be done. And maybe that what else, we need to find it in ourselves to say, let's think outside of the box. I'm saying this because Honorable Chirwa has suggested a very powerful thing to say, let's have a task team. But honestly, how many task teams do we have now? NSP is supposed to be implemented across government and reporting back to Department of Women come to this committee. That's the reporting structure of NSP. Each one to be doing that, they labor to ensuring that they're giving jobs so that people are removed from the shackles of predators. This one doing that education reporting, education ensuring people. So it's all government departments have got a responsibility around NSP. We've got a council now that the committee is in the process of setting up. We've got a fund that has distributed, according to them, billions already, 54 billion or whatever. Something is not right there. So it's not only another structure, but where is what going? So I just wanted to add that and say, let's think outside the box. The structures are there, the laws are there. For example, the 2020 amended Domestic Violence Amended has got 14 categories or 14 areas that have now been declared by law as abuse, to a point where we're talking about spiritual abuse, cultural abuse. All those things are there, which means there are the omotosos of this world are supposed to have been wiped out. Now magistrates have got the room to use own discretion and issue an interdict, a protection order without the person asking for it, number one, but without even the person having come for domestic violence. You may be coming because you are mugged, but you actually say, I'm scared to go home because my husband is going to beat me up because I lost my wallet. The magistrate now has that room. Something is still not right with all of this that we keep weaving into our legislation, and it is not being implemented. So I don't know if my other commissioners would like to come in there for our 3 minutes, but I think from our side, we really are grateful for this opportunity, and we will continue to cooperate and be available to contribute as much as possible. But the problem is very, very big. And even including the environment. That's why I liked what Honorable Chura even said about the environment from which people live. We cannot talk about safe society when we've got geographical areas, jurisdiction that have got more informal settlements where people do not know each other than the formal areas. It's just one example. So it's a whole lot of them. The socioeconomic aspects have got to be looked at. And we look at that. And I take Dr. Litlape's point. We must not try and bastardize poverty and blame everything on poverty. However, we must look at the enabling environment wherein things fall between the cracks, and therefore different groups become vulnerable in different ways, one of which is being violated. Commissioners, from my side, is there anyone who wants to add something? We've still got, I think, 1 minute.
I think your time is up, Chairperson, but it's fine. Okay. But it's fine. If your commissioners want to add, that's no problem.
Okay, commissioners, 1 minute, and I apologize for having exhausted the 3 minutes.
No, it's fine. I'm allowing you extra minutes. Don't worry.
Thanks. Commissioners?
Okay, we can always come back.
Okay. Thank you, Chair. I think you've covered us in principle. Good afternoon, honourable members. It's Prabhashini Subrahman Naidu, DC of the Commission for Gender Equality.
Thank you very much, Deputy Chairperson of the CGE. Over to you, South African Human Rights Commission.
Thank you, Honourable Stan, for the opportunity once again. Chair, I will speak to the two main issues which has been covered by the Chairperson of the CGE. And just to thank everyone for showing up with such clear and well-researched presentations this morning. I'll stick to two issues. One is the coordination, and the second one is the proposal for a national task team. Honorable Chair, with regards to the questions around coordination, we take our guidance from the National Policy Framework on Gender Equality and Women's Empowerment. Those of us who know the history of women's struggles with the state will remember the Office on the Status of Women led by Dr. Alan Connigan. May he rest in peace. Together with the team, they developed the area as the National Gender Pivot Around, because it instructs us to coordinate ourselves and how do we collaborate amongst ourselves. The National Gender Machinery, of course, taken from the initial national policy as well as its later iterations to date, Honorable Chair. And the NGM is a package of structures at different levels of national government, the legislature, as well as statutory bodies at national, provincial, as well as local government, whose aim is to work together in a coordinated manner in addressing issues of gendered violence in all its forms and all its manifestations. Now, at the level of the government, of course, initially the Office of the Status of Women, now in its latest iteration, the Department of Women, Youth and Persons with Disabilities. The DPSA is a member of this NGM, of course, because of its specialization in policy development and policy making. At the level of the legislature, of course, the portfolio committee that we are engaging with today, and other relevant and intersecting portfolio committees, including the Women's Caucus and Parliament. And then, of course, independent bodies, the CGE, the Human Rights Commission, the Public Service Commission, and other commissions. And we establish ourselves both at national and provincial levels under the auspices of the FISD, through which we coordinate common issues, including these. The CEO of the CGE earlier mentioned and announced a joint inquiry that we are currently working towards together with the CGE, the CRL Rights Commission, ourselves. And these are manifestations of how we interpret this notion of an NGM, or a National Gender Machinery. Of course, Honorable Chair, this then leads to the questions around, or the around a National Gender Machinery. The CGE chairperson is correct. When we view the task team within the auspices of the National Gender Machinery, we come to realize that the resources already exist, and the National Gender Machinery is further referenced in our efforts around the NSP. And when we view it within that framework, we understand that not only do the institutional and structural arrangements for coordination and collaboration already exist, but so do the other material resources that are necessary. Our work must be flowing from this engagement is how do we revive those structures of accountability? What role does Parliament itself, given its legislative positionality, have to play in reviving us, in reviving centered on the notion of accountability? How do we strengthen accountability around this issue? How do we ensure we are better coordinated for better reporting? And also, of course, the issues around conditioning, socialization, and cultural change become very important. And they are the purview of institutions like ours as we are gathered today. The role of civil society, of course, can never be overemphasized. So those are my contributions to the questions around coordination, collaboration, and of course, the revival of the National Gender Machinery, asking ourselves what role would the portfolio committee and the legislature in general have in leading us towards those revivals. Thank you so much, Honorable Chair. Very much appreciated. And once again, thank you for the wisdom to hold the platform of this later. Mawande, thank you so much.
Ngiyabonga kakhulu Sompisi for those responses. I want to check if the Sexual Reproductive Justice Coalition have got any inputs. Okay, we go to Dr. Lisa Wibesik.
Thank you, Chair. So I just have a few things to say. The first is in response to the question from Dr. LaRue about evidence of pornography impacting sexual violence among children and young people. The short answer to that question is yes. A lot of the current literature has been produced in the global north, but we're seeing very similar patterns in South Africa and other parts of the global south as people are getting increased access to the internet and data is becoming more affordable for people. Yes, pornography, particularly violent pornography, is influencing how children and young people see sex and understand sex. It is influencing their sexual behavior. And because pornography tends towards glamorizing sexual violence against girls and women, we see increased violent behavior among young people, so intimate partner violence between adolescent partners. That's becoming an increasing concern for us. The other thing is really to appreciate everybody's inputs about funding. We really do need money, not just, this is not me begging for money for research, we really need money for to the care centres. We need money for social workers to be in schools, to be in hospitals and clinics. These are the people who are ideally placed to be first responders for children and young people who have experienced sexual violence. In terms of girls with disabilities, our recent research has shown that one of the key issues that girls with disabilities face in terms of sexual violence is also that they are not visible in communities. We've heard reports, we have evidence that often children with disabilities are sort of kept at home. They don't attend schools. They're not attending public places like churches or public events. So there is perhaps a hidden problem that we're not even seeing. That is something I think we all need to start paying attention to. The second thing is then the other thing is how to deal with child perpetrators linking to pornography. So young people who are perpetrating sexual violence against each other would require a different kind of intervention because they are children. And so their understanding of their behavior and level of responsibility is naturally different. Also, the importance, just to reiterate the importance of closing any gaps in legislation between the Children's Act, Sexual Offences Act, any marriage laws around ages of consent, and any exceptions around those ages of consent, because children, especially girls, are falling through those gaps, and the importance also of registering customary marriages there. The final point that I want to make is just to reiterate the importance of comprehensive sexuality education, not just in the Department of Basic Education's area, but this is broadly for society. Sexual violence, as I said, is a social pathology, and we do need a social response to it. And so comprehensive sexuality is really it's quite broad and targeted at the same time. So it is something that could be offered in adult education spaces to work with SAPs, for example, doctors, nurses, to make them aware. Okay, that's all that I will say for now. Thank you so much for the time.
Thank you so much. We really appreciate it. I see the hand of Jess Roussel. Please unmute. We cannot hear you.
Oh, I'm so sorry, Chair. So this is my proof of life. I am on the board of SRJC, the Sexual Reproductive Justice Coalition. Thank you for giving us a chance to respond again. There are a few points that I wanted to just emphasize that other honorable members and other colleagues have said. One is that one of our submissions is coming from a network of abortion providers and a particular trainer, Sister Judy Renape in the Western Cape, but who's spoken out broadly and done research and training throughout the country with providers. I think that as one of the doctors spoke earlier, I believe with the health portfolio, we cannot underscore the tensions that this puts in terms of mandatory reporting on providers enough. The reason for that is because there's a tension between gender-based violence and sexual reproductive health rights that isn't always understood and certainly not made public enough. We know that there are problems in terms of citizens, people in South Africa, even knowing that safe abortion is legal and that it is available in the public health sector, let alone also in the private health sector. So we already know that just knowledge in and of itself is poor. We also know that access is poor. And while we support mandatory reporting and the existing laws, we also want to just reiterate the fact that we need to protect the girl child and their ability to access services. So as our submission stated, there needs to be a prioritization of training and support for providers, particularly in how to counsel and support the girl child, letting them know that this is not their fault if things are reported, and being able to figure out the nuances of how to build that trust while also being a mandatory reporter. You'll find more details about this from our clinicians' submission. I also just want to underscore what many others have said in terms of the importance of comprehensive sexuality education. Again, that abortion access is legal and is available, needs to be part of that comprehensive sexuality education. Lastly, I want to just support the alignment of all policy and law. There's still policy guidelines from the Department of Basic Education that is not aligned with SOMA in our understanding. And also, just to support the bold moves of coordination, I think the honorable members have acknowledged very clearly that part of these failures are a result of a lack of coordination amongst different government agencies. I think the point from Commissioner Ntuli about focusing this coordination through the existing national gender machinery is an interesting one. Also, in terms of having a high-level ministerial-based coordination committee, I do recognize, as others said, there are many of those, including the ones on the National Strategic Plan on Gender-Based Violence, and as members of academia and civil society, we do wonder if they are meeting because we haven't heard about that. There hasn't been much transparency. The last point that I want to make that is really something I'm imploring everyone here to recognize and think about, and this particular act brings this together very clearly. In the second gender summit that the president held in 2022, the resolutions made it very clear that there are intersections between sexual reproductive health and gender-based violence that are rampant and commonplace in this country. But what I find is that those resolutions are not being taken seriously at the coordination level and also at the messaging level. We need to take seriously the intersections of our lived experiences and how our systems of solutions to protect ones, especially minors, infants, and children, we need to recognize and bring to bear that intersectionality in the way that we coordinate. Thank you again so much, Chair and Committee, for this opportunity.
Thank you so much. We really do appreciate your inputs as well. Can I hand over to Ms. Biela from the Lifeline Rape Crisis? Your hand's up as well.
Thank you, Madam Chair. Am I audible?
Yes, ma'am. Please proceed.
I just wanted to actually comment on two things that were raised earlier on, the issue of the DNA swabs and the specimen. This has been a sore nerve for most organizations that works in the space of gender-based violence, in particular when it comes to rape cases. This, we're not only seeing it as a problem when it comes to teenage pregnancies, but it is a problem with all cases of rape that requires the samples being taken. So I think the first issue is the fact that there is no accountability in terms of who between the Department of Health and the SAPS should really be taking the specimen for the analysis. We work closely with hospitals and the crisis centers. Sometimes the fridges and the crisis centers, when you open it, it will be overflowing of the DNA samples that have been there in the hospital for more than 12 months after it's been collected from the survivor of gender-based violence. And we know that when the rape case has happened, the DNA evidence is very, very important. But when it's been kept in the hospital fridge for more than 12 months, because the OH says we've done our work, we've taken the samples, but SAPS either says it's not their job to take the samples to the lab, or they do not have resources to actually go to Pretoria and take the DNA specimen there. But we also know that with the DNA specimen, actually once after if it's been taken and it hasn't been analyzed after 6 months, the whole specimen starts to deteriorate. So of course, at the end of a certain period, then the results becomes actually not usable because whatever data was taken, it has deteriorated over time. And that has led to a lot of withdrawal of children's cases, especially when you're dealing with young children that really can't go to court and defend themselves. They rely on DNA specimen, but it is said that they wait for 2 years, for 3 years, for 5 years at times for the results that will not come back because that DNA deteriorated and now it's not usable anymore. So I feel maybe something that we really need to look at. When you look at the Sexual Offences Act, it doesn't have timelines as to when the DNA results should come back. So for me, I see the gap there because if there is a timeline that the results should come back after 3 months, I'm making an example, then if the results are not back after 3 months from the date it was taken, then people will be held accountable and they will have to answer as to why results are not back. Because this is actually, for me, that delayed in DNA analysis equals to justice denied for the survivors of gender-based violence, regardless whether they're young or old. They've been denied of justice because their cases most of the times are not strong if DNA results is not there, but it's in ways when it's cases of younger children. So talking about teen moms and people that are going to the facilities for like a termination of pregnancies, that's where my concern is coming from, because that fetus or whatever specimen that is going to be taken, it's going to sit and rot in certain facilities because nobody is being held accountable. And I think it goes back to what we were recommending, that maybe people need to account, whether at a local legislature after every 3 months, but accountability needs to be actually done here, because it's not always about the laws, it's about the fact that some work is not being done on the ground. Then coming back to the issue of pornography, it is another big issue that we are seeing in communities. Young children are having access to cell phones. But what I wanted to bring to the attention of the Parliament is that sometimes these pornographic videos, when they come on the screen of a cell phone, it does not come as a porn video. It comes as a very beautiful car that when you click on it, then it changes into a porn. But it comes in disguise. It's something that young people will definitely look at. And then it's got that view once, that when you go back to say, what was that? Then you can't see it again. So for me, it feels like we need to really sensitize parents about letting cell phones parent their children, because we know that at times they lack devices to parent their children rather than they themselves parenting their own children. But also, I think we need to find ways of tightening laws around pornography in South Africa. They have people that are, this is a business for them. So they try to find all loopholes to make sure that pornography is accessible to young people. It's not about typing a certain word anymore. It's about clicking on a nice picture of a car, then it turns out to be a porn video. So we need to really find other ways of tightening the loopholes and make sure that children are protected, because as they watch pornographic videos, as I said, 14-year-old boys are targeting 9-year-olds. It is increasing the rate of young sex offenders that they practicing what they have seen. So it requires all of us again to act on it. And I will hand over to my chairperson of the Lifeline board with 2 things that she needed to say. Thank you so much, Madam Chair.
Out of time. We are unfortunately out of time, but please do continue with your 2 minutes. Then I've given you extra time.
Thank you so much for that, Chair. There were just 2 very short connected points. If we go to what the person from the CGE said regarding the expansion of understanding through the Domestic Violence Act of what forms of domestic violence there are, is now also being included economic abuse. And that brings us to the inputs made by the chair of the CGE as well as Dr. Letlape regarding, and these are their words, the bastardization of poverty, and that we should not be blaming poverty for everything. But now, having seen that the Domestic Violence Act recognizes economic abuse as a form of abuse, I don't think that we can take that off the table. And then that brings us to the final point that, or to address the elephant in the room, we've all been talking about age disparate relationships. We must also grab the bull by the horns and also address them as blesser-blessee relationships and the ills that flow from that. Thank you.
Thank you very much for those responses. I want to check if the Centre for Child Law would like to make any interventions.
Thanks, Chairperson. Yes, just a few, inputs from our side. And I think what mostly importantly came out from everyone from the presentations was the fact that we do have a very strong legislative framework, but the issue is just the implementation in practice. And I think that is what is mostly lacking. And there was one colleague who had mentioned an issue pertaining to, the summit that took place in 2022 on gender-based violence. And I think within that, there were certain issues that were raised by the children themselves. And one of the issues that was raised by the children was in relation to the NSP on gender-based violence, to say that they feel like their issues are not clearly translated within the NSP, and there was a need for them to have an actual pillar, which is pillar 7, that speaks directly to their issues, particularly when it comes to issues of sexual violence, in terms of what is it that they have to do when they have to report, who are the people that are available to offer them some sort of support. And even to this day, there hasn't been any sort of that, and children again are still excluded in this conversation, whereas even the NSP in itself doesn't clearly speak to their lived experiences, or doesn't clearly outline what are the laws and what are the procedures insofar as children are concerned. And this again now leads to the high numbers of sexual violences rate that we have in the Republic. And we see that whilst the NSP in itself makes mention of the girl child, it again now exclude a boy child. So I think there's just an issue of certain issues not necessarily speaking to each other, but there is a need for us to have like a stronger mechanism or policy that clearly speak about children related issues that are in line with existing legislative framework. And I also just wanted to highlight something important that was outlined by Dr. Tabeng. I'm not sure if I pronounce it correctly, please forgive me. And it was in relation to the issue of reporting, mandatory reporting, so that we avoid pointing fingers at each other. And within the schooling system and other institution settings, I believe that there should be an internal guideline or an internal policy that outlines the roles and responsibilities and the manner in which these cases must be reported. And once and if a policy or a guideline has been developed and is developed from a legislative framework or a policy, there is again a need from government stakeholders, particularly DOJ, DSD and DBE, to provide some sort of like training or capacity training for the teachers, for the nurses, so that they understand their level of intervention when it comes to these cases, so that again they can avoid reprisal from others and so forth. Because I think the reason as to why maybe we might have a disconnect when it comes to who reports and who does not report is because of there isn't very much clear guidelines within this institution themselves that guides the process in terms of who needs to do what. Because in as much as we have section 110 that says that every person and any person has a role or an obligation to report, we still need something that the schools or the institution can use to guide their own internal process in terms of like reporting, so that even if it's a matter that will lead to like some sort of like a strategic litigation, there can be a need for us to look at those particular policies that guides the process in terms of how they report. And also on the issue of consultation, I think it's also very important that within communities we raise awareness, we raise public awareness, and from this, and we have the community members who are directly affected speaking to these issues, so that they can be able to then now inform policies. And also again developing some sort of like advocacy material. Advocacy material are very important, and I think it's one of the things that Center for Child Law has always been making sure that we develop policy material, or rather advocacy material, that clearly speaks to the challenges that are faced in communities, or that speaks to what the legislative is saying, but we do it from like a very simplified manner in which any person in a community can be able to understand that these are my rights, these are my responsibilities. When this happens, this is what I need to do, and all of that. So I think there's also a need for us to, advocate for a very robust, advocacy materials to be provided within communities, but that must be done in a language that can be understood by every single person. And there was also another issue of, coordination, and also the existence of legislation. So in legislation, I think the only issue is the fact that certain legislative framework, they don't necessarily speak to each other in terms of roles and responsibilities. And what I think we can recommend as Center for Child Law is the fact that there should be an interdepartmental protocol or a guideline that outlines the roles and responsibilities of every single stakeholder, so that it can be clear for us to hold each stakeholder accountable, and also for each stakeholder, particularly SAPS, DSD, DOJ and DBE, to understand that what is their roles and how they should respond to certain cases that have been reported to them. Because I think that might be one of the ways that can cure some of the challenges that we are currently facing. But the most important thing is to always think about the best interest of the child, and making sure that this vulnerable group is not left behind, and we have laws that clearly speaks to them. Because if we just have laws that are just sitting there but not being properly implemented, it will just lead to us having to go back and forth and having to to, to resort to litigation, whereas sometimes it's just a matter of us just sitting down and having a conversation in terms of what can be done. But that can be done if, all of us, we come together, we have something, down on paper as a sort of like interdepartmental protocol. I think that what can really assist. Thank you very much.
Thank you very much. I'm going to hand over to Dr. Joan van die Kerk.
Thank you very much for the opportunity to say something again. Just to note, in relation to the doctor who talked about pornography, this is why I have such grave concerns about the neglect of the Department of Justice to do something with the SA Law Reform Commission recommendations on protecting children against exposure to pornography, as well as limiting those opportunities for both children and others. I have a second thing that I just want to mention. So please, some activation. I don't know if there's anybody from the Parliamentary Portfolio Committee on Justice here, but really they should be holding their department accountable for the failure to protect children from exposure to pornography. The second thing I want to mention is most mention of boys at today's meeting has been around boys as young offenders. I just want to reiterate information from the Optimus Foundation on child sexual abuse in South Africa. And in actual fact, their research indicated that boys are more likely to be victims than girls, not by a huge percentage, but it was like 33% of girls and about 35% of boys suffer some form of sexual abuse during their childhood in South Africa. This is very concerning because we are definitely undercounting boys. Their research also indicated that boys are reluctant to report. And the sad finding in their study was not a single boy in their research sample, and they included thousands and thousands of children, a properly balanced sample, as you can imagine, from the Optimus Foundation. Not a single boy had reported to a police person or a social worker. The reports were to parents, to peers, and so on, who then might report to the formal system. So somehow or the other, we are missing dealing with boys as victims. And we do know that boys often externalize their trauma. And so perhaps it's not surprising that we see more alleged sexual offences happening from boys as from girls, and how boys grow up to struggle with the issue of responsible sexuality. And I don't want people to think that every boy who's been abused is a danger to society. That's absolute nonsense. But we are missing the boat when it comes to the reporting of sexual abuse on boys, and helping them link to services that would provide them with the trauma therapy that they do need. So thank you again, Madam Chair. I think that we've had a very valuable morning.
Thank you very much, Dr. van die Kerk, and we do really appreciate your time and your inputs as well. I want to check if Dr. Janine Hicks would like to give us any further inputs.
Thank you, Chairperson, and appreciating the comments raised by our honourable members. We have already had inputs from two of our colleagues on our working group in the province, speaking to issues of pornography and provincial collaboration. What I would like to do is to invite one of our colleagues on the working group, Ms. Pat Moodley, who is the former regional head of the Department of Justice in the province. She would like to make further input. So with your permission, Chair, can we invite her to unmute herself and use our minutes? Thank you.
Thank you. Over to you, Ms. Lee.
Hello, Chair. Good afternoon, Chair, and good afternoon to all the members. I'm so appreciative of this opportunity. I'm going to put my video off. It's distracting me. I just wanted to make a couple of points, and that is that it's great that today we are talking about violence against children. I think a lot of emphasis has always been against, when we talk about gender-based violence for all of these years, it's been violence against women. And violence against children, is a whole category on its own, and we haven't fully explored all of its different nuances as yet. But today we're talking about sexual violence against children. And what we also need to understand that very often, as we have seen recently in South Africa, this violence translates into child murder. And in our country, we don't even have an official definition for child murder when committed by a parent or parents, and that's filicide. And so what I want to say is that there's one case in particular I'm going to speak to, and that's the Siobhan Roche case. Siobhan was a 4-year-old who was killed by her mother and her mother's boyfriend in November 2023. And for me, I've worked for the past 27 years in the Department of Justice, and as Director Legal, I used to deal with all the sexual offences and related matters. But this case really, for some reason, touched me in many ways. And I just want to talk to you about the issues that concern me about this case. So eventually the mother and the boyfriend were convicted and they were sentenced. But during the course of the trial, 2 witnesses gave evidence, and both witnesses said that they had made complaints, one to SAPS and the other one to DSD. Now, the case has long since concluded. What have those departments done to ascertain to whom were these complaints made and what happened following those complaints? Were any of those officials held accountable? Because this ended in a child's death. And I think that those gaps are really what concerns us and concerns many of us, because the structures are there, the policies are there, the guidelines are there, but the linkages is what's missing in what we're trying to achieve. And I think, Chair, that your department, actually, the Women, Children and Persons with Disability, is probably the glue that can pull all of this together. You can hold everybody else, if not accountable, hold them to answer to these questions that cause children this kind of harm. Thank you, Janine.
Thank you, Dr. Hicks, and your team. Colleagues, is there anybody else that would like to? I'm hearing an unmuted mic. Oh, it's Miss Moodley. Okay, colleagues, this now brings us to the end. Colleagues and stakeholders, brings us to the end of our morning session. We are now going to take a 20-minute comfort break, and we will reconvene at 2:00. At 2:00, we'll only have 2 more presentations. One of the presenters has unfortunately gone to the doctor and will be writing to us or giving us a written submission. We will also be getting a written submission from UNICEF and the Nelson Mandela Children's Fund. So after the 2:00, when we restart at 2:00, after our quick break, we'll have 2 more presentations, whereafter I will allow for 1 more round of comments and inputs from honourable members, if there are any, before we close, which should be just around 3:00. For those of you who cannot stay with us for the afternoon session, I would like to thank you again very much for your time this morning, for the constructive engagement, for all the proposals that you've put on the table. As I said before, we are going to be preparing an initial report for the National Assembly in conjunction with the other portfolio committees, which we will make available to all our stakeholders. And we would also need to find a way of publicizing it, whether it's on the parliamentary website or through other platforms. But colleagues, for now, I would allow you to have that 20-minute break, and we will reconvene at exactly 2:00 for 2 more presentations. Thank you.
Recording stopped. Recording in progress.
Good afternoon, honourable members and our valued stakeholders. We are back for the afternoon session of our parliamentary statutory rape of girls inquiry and stakeholder engagement. I want to check Honourable Chauke Adonis whether the chairperson of the Disabled Women's Organisation of South Africa is on the platform and ready to present. She was due to present to us at 2:05. We can allow for another 5 minutes if she needs 5 minutes. Can you just give me an indication?
Thank you very much, Chairperson. I think they can indicate that they are on the platform. I know the Chairperson of Disabled Women South Africa will be the one who is presenting on behalf of the organization. Perhaps if we can request that they unmute and indicate their state of readiness. Thank you very much.
Thank you so much, Honourable Whip. If they can also just, yes, unmute, show their video and introduce themselves.
Good afternoon, Chair.
Good afternoon, ma'am.
My name is Tandiwe Mfulo. I'm from the Disabled People South Africa Deputy Secretary General. The chairperson will join now. Now she was struggling to join. She will join now because she's being online. So I'll just, maybe you can give her some few minutes to join. Thank you, Chair.
Okay, yes, you were scheduled to start presenting at 2:05. So we will allow you that 3 minutes. Colleagues, I just wanted to say Ms. Jumna Alexander from Helping Hands was set to present as well. Unfortunately, she's had a medical emergency and she will submit a written submission. Also, the same goes for UNICEF South Africa and the Nelson Mandela Children's Fund. We will be requesting them to send to us written submissions. So we will take the South African Disabled Women's Organisation now, and that will be followed by the South African Child Rights Coalition chairperson, whereafter I will allow honourable members again to make any inputs if there are any further questions or inputs. Over to the chairperson of the South African Disabled Women's Organisation, if you are ready. I also see Ms. Monica Woodhouse has joined us. Good afternoon, ma'am.
Good afternoon. Thank you so much. Thank you for this opportunity. Could I'll maybe, do you want to do the slides or shall I do them? I'm at the airport because I've just landed.
Okay, no, I think we can give you, just hang on for 2 seconds, Ms. Woodhouse. We're going to check if the first person before you is the South African Disabled Women's Organisation. So it gives you 15 minutes. It gives you 15 minutes if they are ready. Otherwise, we will call on you. So let's just, Ms. Mfulo, Tandiwe.
Chair, maybe we should give him first a chance to because is the chairperson there? There she is. Thank you, Chair.
Okay. Thank you very much. Colleagues, okay, let me hand over to the South African Disabled Women's Organisation for their 15-minute presentation, whereafter we'll go to Ms. Monica Woodhouse. Over to you, Chair.
Thank you so much, Chairperson. Good afternoon, members and everyone who's in the meeting. My name is Bongiwe Matsane. I just came in now. I was running around. Thank you for the opportunity that you have been given to us. Sorry for not submitting the presentation on time. We just, it's not me that was supposed to present, but because we have to and render this service.
She got it.
Ms. Matthews, please can you just mute yourself? I'm sorry for that. Chairperson, please proceed.
Yes, I'm just trying to look for my presentation because I'm no longer on my laptop now. I'm doing it over the phone. Okay. Thank you so much once again. The presentation that we made, I'll just read into it because it's something that I have on my phone. Thank you for the opportunity that as persons with disabilities, we are also invited to come in this platform and also raise the issues in terms of statutory rape of young girls with disabilities. Girls with disabilities, whether physical or sensory, intellectual or psychosocial, with multiple disabilities are also being
Did we lose the presenter, or is it only on my side?
It seems like we lost her, Chair.
Okay, thank you, Mr. Dumisweni. Okay, while we try and sort out the issues around the South African Disabled Women's Organization, Ms. Woodhouse, if you are ready, we will give you this opportunity.
Thank you so much. I really appreciate that, and I really appreciate this opportunity to share today as well. And is it possible for someone to flight the PowerPoint for me? Would that be possible? Or do I have to share it? Can I share it off mine?
You can also share it off yours, but Mr. Dumisweni can also assist.
That would be great, just because I'm at the airport.
Okay. Mr. Dumisweni, can we assist?
Otherwise, I'll do mine to save time.
Okay.
I don't know. I would need some to be able to share then.
Do you have sharing host?
I'm still trying to access it.
Oh, you're trying. Okay, thank you. Sorry about that. Maybe just while he's trying to find that, I just want to say to the honourable members of Parliament, it really is an honour for me to be with you today, and thank you for this opportunity. And I really admire this portfolio committee for taking the time to listen to all the amazing but sad presentations that we've heard today. But I want to say one thing: it really gives us hope. I think it really gives us hope to know that there are people like yourselves who are willing to listen and be part of the solution. So, okay, it looks like he's going to be sharing it. Yeah, thank you. So we can go to slide number 2, where I just introduced myself. I'm Monica Woodhouse. And today I stand before you not only as a founder of Give a Child a Family Africa, but also co-founder of the representative and chairperson of the South African National Child Rights Coalition. But more than that, as someone who has walked alongside children, families, and communities for over 4 decades, and I speak from the front lines of pain, resilience, and hope. We have seen the unimaginable, and when I say that, I mean a 2-month-old baby raped and physically destroyed, children as young as 10, as we've heard this morning already, pregnant, families torn apart, then systems that fail them again and again. Go to slide 3. Give a Child a Family, really, we believe in strengthening, empowering, and working with families, because until we can actually get down to collaboratively dealing with families, because then we're not going to really win this battle, win this war of statutory rape. And we believe that also in the fact that we have things like grants that we pay out to families And for us, that's a great opportunity to use that as teaching and training and empowering the families when they receive the grants to be able to get assistance with that, so that we can actually start putting it into bylaws or policy that if we're going to pay out grants, let's also train these families. And so we have worked with victims of abuse, families, community moral office bearers, traditional leaders, perpetrators seeking rehabilitation, and much more. Then we go on to slide 4. And here I just want to present to you the South African National Child Rights Coalition. We realized as an organization ourselves and many others that being on our own, kind of one organization trying to bring change, was not going to make a difference. So we have gathered a coalition of about 126 organizations, and we now even have a child advisory board that's also represented from across South Africa. So there are 5. It's a unifying body. It's evidence-based advocacy, and we jointly put in presentations, deal with the media. We have 5 key focus areas: child rights governance systems and mechanisms, evidence-based child rights advocacy, coordination, networking and collaborations, institutional strengthening and sustainability, and child participation is a very big aspect that we are really driving the agenda of children. And I'm going to skip the next 3 slides because I've heard everyone this morning, almost all the presentations. So if we can go to slide number 10, or 11 actually, because we have heard all these statistics, and I don't want to repeat that for fear of being boring, and also just for the fact that these things have already been identified. But if we can go to empowering civil society, which was slide number 10, looking at for us now, just to say how we believe, we can go to the next slide, sir, is that we need to, civil society must be empowered to work together with government. And I think, having been in this field now for more than 40 years, I have seen that this is, we work in silos, CBOs, NGOs are not consistently empowered to work with these issues. They work with them, and we need effective strategies. Family strengthening, community mobilization have proven effective in combating child abuse and statutory rape over decades. Even our organizations, we have seen change when families are supported, when communities are trained, when children are listened to. We need to look at inclusive policy implementation, including civil society and policy, ensures interventions are locally grounded and have lasting positive effects. Then we need to look at leveraging expertise. Recognizing and utilizing civil society expertise is vital for systemic reform, because we cannot just, what's happening is that because of the silos and because of all the different governmental departments, there is not, we have not identified that there's a systemic, the issue is a systemic issue. And so that's what needs reforming to protect children's rights. Resource and budget support for civil society. I can't emphasize this enough. Like we've heard about the Tutuzela centers. I heard Dr. Joan on that. And we really have to look at how can government not just be part of some of erratically, but actually looking at all the work of the NGOs is underfunded, under-recognized, and excluded from decision-making in a lot of situations. And they're also just not service providers, but they are change makers. Can we move on to the recommendations? Next one. So our recommendations as a civil society is to a comprehensive legal overhaul, looking at addressing this as a systemic failure with effective legal frameworks. We need to look at cross-departmental coordination. Children's issues, youth issues are intersectoral, and they have to be seen as such and have to be worked as such as well. Every department of government, every NGO, every home, every faith-based organization, every traditional leader, all have to do with children and families and these issues. So cross-departmental coordination is absolutely necessary. Mandatory reporting and protection, enforcing mandatory reporting laws, and then in dedicated budget. I know that even when we have a beautiful Children's Act, which I'm going to come to just now there, but the implementation of that and the budget of all the incredible policies that we have, we have to look at budget and training. Then we have to establish a cross-departmental task team under the Office of the Presidency to oversee child protection and child rights and responsibilities. Then implement the Children's Act, not just in law, but in practice. It remains one of the best. Our Children's Act remains one of the best in the world, but without budget, it's a paper tiger. Then we need to look at training communities, caregivers, professionals, not in isolation, but through structured, integrated programs. And then in KZN, which is the areas that we've worked in, we've worked very much with the Operation Supumasaka, the war rooms, as they call them here. When the system works, it really works well and has worked, and it's a fantastic option and a great system for each local municipality to implement and hold their people and their councillors and people accountable. So looking at operationalizing that would be great. Then we can go to the next one, the call to action, and go to them. Thank you. Prioritizing children's safety and civil society inclusion. We are calling as a coalition of these 126 organizations, plus the children. They have spoken over and over and over again about reviving the Office on the Rights of the Child in the Presidency with accountability mechanisms, not just DBE, DSD, and DOH, which we've alluded to a lot here, but even with COCTA, Transport, Home Affairs, SASA, all of the departments, because as I said, it's intersectoral. Then we need to look at overhauling the Department of Justice and SAPS in handling child abuse cases. That is extremely challenging, and I'm not going to go into details. We've heard all the others talk about that. Children's Safety and Rights Parliament must act decisively to safeguard children's rights and responsibilities through enforceable and practical measures. We have, in our own organization, worked in 12 different countries with regards to training moral duty bearers as well as families in family care. In family care, children's rights, and understanding children's rights and why we need children's rights. Because once the families understand that, they have no problem aligning to it. Then we need to look at empowering civil society, recognizing and giving them mandates, not just contracts or saying we partners in word, but in actual a mandate. Include them in policy design, fund them through treasury allocations, not fragmented grants. And then we need to look at government integration and accountability, integrating civil society and government frameworks and establishing accountability that ensures meaningful reforms for children. Thank you. Let me go to the next one. And I just want to say thank you very much, honourable members and honourable chair, for this opportunity. We are not here to point fingers. We are here to build bridges. The system is broken, but it can be rebuilt, not by government alone, not by civil society alone, but together. This is the key. And I think we want to work with government. We have said that over and over and over again. We want to work together, closer and with purpose. And having just watched a little bit of rugby this weekend, I want to say that South Africa rugby has shown us how to do this. We are stronger together. And so I just want to say, when I listened to all these beautiful presentations today, I thought, imagine if all of us could be part of the solution, could be part of looking at policies, part of it makes practice and putting these things into. I cannot imagine that would be a beautiful task team. So let's stop working in silos. Let's listen to the voices of those who have lived this reality and make sure we also include children and youth's voices. Let us act today, not tomorrow. But I want to also just end off with a quote from the Polisi Foundation that says, "Children are not the future. They are the present. When we speak of them as future, we turn a blind eye to the urgency with which we need to address their current realities. We absolve ourselves of the responsibility to make better decisions now that are for their good." Thank you very much, and I want to thank you so much for this wonderful opportunity, and we look forward to working with you more as a coalition. We would love to be more involved and have further collaboration with you. Thank you so much for this opportunity.
Thank you very much, Ms. Woodhouse. Thank you very much for your time. I know you also had to travel today, but you still had made time for us this morning. And thank you for your inspirational presentation. There is indeed unity, strength. Well, when we are united, we are stronger in our common purpose to tackle this crisis that faces us. I want to see then if the disability organization, South African Disabled Women Organization, is ready for us to give their presentation.
Yes, Chair.
Thank
you very much. Yes, Chair. It's Tandy. My chairperson's network is very bad. So she said I must assist in presenting around the statutory rape. What you are saying is, although South Africa Constitution and the White Paper on the Rights of Persons with Disability affirms equality and dignity for all, women and young girls with disability continue to experience multiple and intersecting forms of discrimination. They face gender-based discrimination plus disability-based exclusion. So you can imagine if you are having these two things, Chair, what is really happening. And then gender-based violence remains one of the most devastating human rights violations. Young girls and boys, young women with disability, especially those with mental disability, they face multiple and intersecting forms. Their experiences are often invisible in the mainstream of GBV actions and interventions. Evidence shows that disability, especially for young girls and young boys, both of them, they are equal. They are very at a high risk, likely to be financially dependent, and not to be believed when they go to report the violence. And they are being excluded in the feminist and gender rights spaces. The stigmatizations for socially, culturally, and economically, they are being, violated. In terms of the policy context and framework globally, Sustainable Development Goals 2030 Agenda and humanitarian law, of which gender equality and the elimination of all forms of violence and discrimination against women, girls, and young boys are the integral part. The United Nations mission is to advocate, prevent, and ending violence against women and girls. But when you look at it closely, you don't see girls with disability, women with disability, boys with disability, even if there are programs. So 2030 agenda, the DSG, the SDG 2030 agenda, goal number 5, it talks about achieve gender equality and empower all women, girls, and boys. Does it happen? No. Goal number 10, it talks about reduce inequality within sustainable and amongst countries. In our country, does it happen? No. The UN Convention on the Rights of People with Disability, Article 6, Women with Disability, Article 16, Freedom from Exploitation, Abuse, Violence. We've got South African National Strategic Plan on GBV. They call for inclusiveness, protection, and justice for all. Does it happen for people with disability? In terms of the law, or let me report about, in terms of the law, the Constitution of South Africa of 1996 is protecting disability. The White Paper on the Rights of Persons with Disability, 2015, is there. The NSP-GBF, it's there. The Children's Act 38 of 2000 protects children with disability. It mandates reporting, ensuring accessible services. We don't have those. Instead, there's a lot of hidden crises. Women and girls with disability are likely to experience GBV more than anyone 2 to 3 times. Many cases involving children go unreported due to stigma, disbelief, fear within families and community. Statutory rape of young girls with disability don't see the light of court. The barriers reporting and supporting that. It's lack of accessible information, poor disability sensitivity among officials, dependence on abusers, inaccessible shelters and reporting mechanism. Families fail to report rape of children with disability due to stigma. When you go to police station, and just make a simple example, and you are deaf and you want to make a case, most of the time we have to intervene, because when they arrive at the police station, the police are laughing and say, this one is mad. Because the person is talking with hands, so they don't care. They don't even think that that person has got a disability. If you are blind, they will ask you a question. Did you see that person that raped you? Those kind of information that they don't have. And I've written in the platform to say, we need every training that is there in South Africa. Whether you become a lawyer, but disability should be part of the curriculum, so that this kind of thing should not happen. The barriers that reporting, it's lack of accessible information on rights and services. I've talked about police, social workers, and health workers often lack disability sensitivity training, dependence on abusers, inaccessible reporting mechanisms and shelter, fear of disbelief due to stigma, and all of these things, Chair, psychological and social impacts. It's a trauma and anxiety. It's a loss of trust in caregivers, withdrawal from education, regression or worsening condition, perpetuation of silence and isolation. And these are the persistent challenges. Despite strong policies implementation, it remains weak. Women and girls with disability remain excluded from mainstreaming of the GBV programs and justice mechanism. So there's a call for action here. We need to engage departments and partners. All the departments of government, all civil society that are there that don't deal with it, all private companies, because the challenge comes all over. And in terms of traditional healers, they play an important role in communities as trusted figures and first points of contact. The reason why we say that, because there's cultural belief, there's, Christian belief and whatever. So those beliefs sometimes they make that there's more perpetrators, or there's more violence, or there's more GBV for women and girls and boys with disability. And then many survivors, especially in rural areas, they first disclose their abuse to traditional healers, but do they do anything around it? So the collaboration is needed between traditional healers, healthcare workers, and law enforcement. So, Chair, we're saying the objective is to enforce Children Act, reinforce mandatory reporting of abuse, disability-sensitive GBV training, community empowerment, inclusive leadership, and access to justice. But the quick question for reflection is, how can families and community break the silence? How do we ensure accessible justice and reporting? How can allies strengthen inclusion in the GBV space? And our expected outcome is to say inclusive accountability and reporting, community education, visible participation of women and girls with disability. In conclusion, Chair, nothing about us without us. Ending GVB requires inclusion, accountability, budget, and the courage to report abuse. The Children's Act reminds us every child's safety is a shared responsibility. I thank you, Chair.
Thank you very much, Ms. Mfulo. And I do want to say that as much as we have to agree that we are collectively failing our children as communities, as society, and as leaders, we also must recognize that we are failing persons with disabilities. We are simply not doing enough to protect their rights. So we really do thank you for your time and that presentation. I'm going to check if honourable members would like to ask any last questions or give any last inputs. And I will be taking your hands if you can raise them now.
Chairperson, I'm unable to raise my hand. If you will then acknowledge me. Thank you very much.
No problem, Honourable Chauke Adonis. Let me just see if anybody else would like to make any further comments or inputs. Okay. Then we are just going to hand over to you, Honourable Chauke Adonis. It's your opportunity.
Thank you very much, Chairperson. And I would like to appreciate the two presentations that were made to us. Very high level and comprehensive. I think one of the issues that one would always raise would be the neglected sector. And I appreciate that we've got Disabled Women South Africa that is on the platform that is really escalating and raising the plight of young girls with disabilities who always fall through the cracks. I think one of the things then we are then looking for also from both the presentation is to say, how do we then collect segregated data that speak not only to demographic groups, but also to geographic locations. I know currently, Chairperson, with the statistics that we know Gauteng and the Eastern Cape have the highest rates of statutory rape and minor abuse and neglect. I think we must also start to really take it at a microscope point of lens to say, how do we ensure that even the most vulnerable are being protected? And then lastly, Chairperson, if I may, it would be, how do we ensure, and this goes to all our presenters that we have had on the platform and also to the portfolio committee members and the different portfolio committees, how do we ensure that there's a level of accountability? If I am a parent and a case has been brought forward of statutory rape and I withdraw that case, what then happens to those parents? And that speaks towards accountability, number one, but also ensuring that when we speak about mandatory reporting, there is levels of consequence that must take place. If you've got an educator, you've got a service provider such as a medical service provider who gets a teenager, a minor who is pregnant and does not report, the failure to report from a clinical level, from a point of education, from communities, what accountability measures are put in place to say that there must be some sort of consequences? We know that in schools of special needs, there are high rates of statutory rape that are taking place. And these are falling completely through the cracks to a point where we've got special needs schools that have been closed down when these cases are then brought about and then they are silenced. So I think, Chairperson, my last remark on this is to say we must start to really look at this from a microscopic lens and really start to deal with the root cause of a statutory rape, but also how do we ensure that our traditional leaders, as we have done in our inquiry in the Eastern Cape, are fully participating and themselves are contributing towards us combating statutory rape and abuse against the young girls and boys. Thank you very much, Chair.
Thank you very much, Honourable Chauke Adonis. Dr. Leklape. Dr. Lehlape?
Thank you, Chair. My gadget was failing me.
No problem.
Just a few.
Please proceed.
I think what's going to be important, Chair, is to ensure that we have a program of education and engagement, particularly of societies that are affected, and reinforming the cultural values and aligning them with human rights. The second issue is victim support. Support is lacking. The third issue would be the issue of restitution, so that people should not use people's financial circumstances as an excuse to exploit. But there has to be restitution for those families. That is in law. That is not a voluntary bribe from a perpetrator. And we need to ensure that there's proper cooperation across ministries. I hope this would be a call for a comprehensive review. The law research area is critical in terms of ensuring that our laws are aligned. There's a committee that does legislative review. We don't need to set up a task team. We need to ask that committee to do its work and give us information so that we align the laws, particularly on issues around consent. And we probably need to look at the issue of not talking about consent, but talking about sex across generations and age gaps, and criminalize that without alluding to the issue of consent, because consent becomes a red herring and we're going to create a legal minefield where we'll have cases that drag on forever in our courts. Thank you, Chair.
Thank you so much, Dr. Lehlape. Honorable Tsotetsi.
Thank you very much, Chair. Chair, for some time my gadget was blocked off due to the connectivity problems. I hope that I will not be raising issues that people might have raised while I was kicked out of the meeting. I would have heard the report of Lifeline earlier on mention that they are supporting about 752 survivors. They've supported in about 12 months. 752 survivors. I'm interested in finding out, perhaps we don't have relevant individuals here, to make a comparison between that number which they say they've supported against the stats of the police. Because when we were in the Eastern Cape, one thing that we would have picked up is the fact that there is a disjuncture between the stats of the police together against the stats of the Department of Health. Of course, owing to the question of lack of proper reporting channels or people not taking up their responsibility to report against the stats of the police. So I'm interested to see if given the fact that Lifeline says that they do have these numbers, do we have the same situation whereby the stats that are picked up by civil society are totally in opposite to what the law is what has been processed through the law and the justice system of the Republic? If that is the case, then indeed we must attend to this problem. Yeah, I think that the proposal for the development of the anonymous reporting system must be quickened, and perhaps when we give report to Parliament, we must raise a recommendation that comes with the time frames for the implementation of that kind of a system, because clearly this disjuncture between the reporting of cases and the prevalence of cases in society is a big problem. And I would want to think that it would be important that we ensure that everybody gets understand the agency of us attending to this question of the reporting. So this thing of anonymous reporting system, we must really give it time frames for implementation by the consent entities. it's concerning Cape. This thing came again in Eastern Cape, where we have a problem wherein even the cases that are reported, you find that they do not go anywhere because the families or the victims withhold information. They don't disclose the perpetrators. The families would even move kids away from where they are so that they cannot cooperate with the law enforcement. I think that we really need to find a way, a program that can be canvassed publicly together with civil society that can, in line with what Dr. Klappe would have said, that can drive education in this regard so that we improve response by the communities. Thank you very much.
Thank you so much, Honourable Tsotetsi. I'm now going to take the hands of our stakeholders to see if anybody would like to make final comments. Commissioner van der Merwe from the CGE, I also saw you made some valuable comments or inputs on the chat if you wanted to speak. But now is the opportunity for the stakeholders to give your final thoughts and inputs if you would like to do so. I'll take hands. Okay, Ms. Biela.
Thank you so much, Madam Chair. I think my one is the comments from the last speaker just now, who was asking about statistics in terms of what Lifeline is seeing, whether it's the same as the cases that are being reported at SAPS. I think I just want to clarify, firstly, that 727, those are the cases of young girls that were reported that are dating older people. But in terms of rape cases, it's much higher than that. I know that in the last financial year, in Mgungundlovu district alone, Lifeline supported 4,923 GBV survivors in just one district, and 1,461 of those were rape cases. So, but coming back to whether the stats tell us with what is happening at SAPS, the answer is definitely no. And the answer is no because there are a lot of survivors of rape that, especially adults, that have given up reporting to the justice system if they are survivors of rape. They feel that most of the cases that have been reported, they go nowhere, and they feel that they will be embarrassed. So sometimes they will go only to the hospital for medical care, and they will go for counseling to actually manage or deal with the trauma of rape. But most of the adults, they will refuse to go and open the case. So I'm pretty sure that the stats, if we have to compare it with SAPS, it's not going to be comparable. You'll find that they've seen far less cases that are reported. As we also know, people find it very difficult to report rape cases, especially if you have to go to the charge office and tell people at the charge office in front of everybody else what had happened to you. So that as well is something that makes people to be very, very reluctant. It will be something that as a country we really need to get into, where the statistics on gender-based violence talks at the national level. I always say, I remember the times when we had COVID. There was that dashboard on our televisions that every morning when you open your TV, you'll see the number of cases of people that we infected with COVID-19. So the dashboard was collecting the stats at a national level very fast. We could all see where we were as a country. I believe that system was very good. And if we could have a system like that when it comes to gender-based violence, at any given moment, we can see how we're doing as a country. I think that will be a good investment to actually have that system that all people that are dealing with rape cases can go capture that information there as they get the case, so that we'll see how far we are, whether we're making any progress or not. But definitely states are not talking to each other. Thank you very much.
Thank you very much, Ms. Biela. Can I just check if there's anybody else? This is now your final opportunity. And I think we all agree with the dashboard idea. I would like to now recognize Her Royal Highness Princess Mogane, Commissioner for the CGE.
Thank you so much, Chairperson. I hope I'm audible.
You are, Commissioner. We can hear you.
Thank you very much. I really appreciate the opportunity. Chair, mine is just very few pointers just to come on. Yes, I'm a commissioner for the Commission for Gender Equality, but also to amplify on the traditional leaders. You know, I'm deployed here in Mpumalanga, and it's 70% rural area, which means it's a majority of traditional leaders in our side there. So what I want us to also just do collectively, I'd want to recommend is let us also, first of all, learn to define the difference between what is culture and what is an obvious witchcraft practice, because I'm seeing that is what we are trying to also work towards within Mpumalanga, where we know one culture is, for example, in KZN, there's the Umemulo, where it's the coming of age celebration, which is a very proactive traditional act that we have, or traditional celebration that we have. That is just to encourage virginity, abstinence. So we need to ensure that we're able to just promote such programs or cultural practices in our areas. And then comes to the issues of, like I said, the witchcraft practices, where we find that there are key business individuals, there are key community leaders who are told that if you want to have more power, if you want to have more wealth, sleep with virgins. So you see the narratives that are being passed on that we're trying to also just look into. And when you look at the South African Witchcraft Act, the last time it was reviewed, it was in 1957, and the chairperson of the committees mentioned which acts do we need to look at, and I think that's one of them that we need to definitely unpack and put more clarity on what we mean when we say what is witchcraft practices, what is cultural practices. It's very key for us. And another thing, please, as we are all here collectively saying we are going to walk this journey together, I fully agree in being able to call each other out as well. So when we see individuals, for example, if you go to, there's a church in KZN as well, where they promote, it's of course polygamy, but the brides or the new brides are young children. And they say it's part of their church. And I know a lot of people do know that it's the Shembe one. So do we call them out as well? Do we approach them or not? Because it's more faith-based. I think those are the key things that we need to look at. However, let us learn to celebrate those cultural practices that do take place that actually want to proactively promote the protection of our children. I'll stop there. Thank you so much, Chair.
Thank you so much, Commissioner, for your inputs. Now is the final opportunity for anybody, if you would still like to make any comments, any suggestions. Dr. Leklape, is it a legacy hand? Okay. Looks like it's a legacy hand. Colleagues, stakeholders, I would like to then just say, if you do have any additional recommendations that you would like to still submit, you can do so in writing to our portfolio committee. You do have our details, and you're free to make additional submissions or inputs if you so wish. This then brings us to the end of this engagement. I want to thank each one of you for being with us this morning. Thank you for your time. Thank you for your valuable inputs and recommendations. I would also like to thank you again for the valuable work that you are doing in our communities, in support of our children, and in service of our nation. And we understand that civil society often do very difficult work, even our academia, difficult work with little resources and little support from all of us, and we can only really just thank you again. Firstly, I want to say that we've listened to your recommendations. I know often you come to these platforms and you engage with Parliament, but you don't really see the change that you would hope to see. And I want to just say, we've said that we will walk this journey together. We will support each other going forward. But as a portfolio committee, and I can't really speak on behalf of all the other portfolio committees, but I do hope that we can tell you that we've taken your recommendations seriously, we've valued your inputs, and we're going to take the suggestions you've given us and give them the proper attention that they require. Because at the end of the day, our voices must rise together in support of our vulnerable children in our communities who often cannot speak for themselves and need us to protect them, because not only do we have a constitutional obligation to do so, but we've got a moral obligation to do so. So I want to also say that we've heard from you that we need more resources for this fight, more resources in the form of social workers, better training for all those involved. We need to end the silo approach. We need an online anonymous reporting system, and we need accountability for those who fail our children. With those few words, colleagues and stakeholders, I want to wish all the portfolio committees well that will be engaging in this process throughout the week. We will be touching base again with one another, stakeholders, when we have finalized our initial report, which we will make available to you and which we will also publish online on the various platforms. Our meeting is now adjourned, and I thank you very much again for attending this morning's stakeholder engagement. Thank you, colleagues. Thank you, stakeholders.
Thank you very much, Chair.
Thank you very much. Long live the chair.
Long live my colleagues and our civil society and stakeholders.
Thank you.
Thank you. Thank you. Thank you, Mama Fisani.